We are live on YouTube now.
Okay, thanks.
Okay.
Right. Hello. Am I audible?
Hello.
Yes, sir, you're audible. You're audible.
So yesterday, you people have sent a lot of chits. So regarding that, just two things I need to point out regarding two chits. One is China.
Mr. Natik, your voice is very low.
Okay.
Could you?
Is it okay now?
Yes, yes.
Yeah. Oh, I just have to position my mic carefully then. Yeah. So China, when you reply to a chit, you've written substantive chit at the top. Just to let you know that when it's a POI chit, when you're replying to that, that chit will also be just a reply to a POI. So that chit cannot be a substantive chit. Substantive chits are separate things. So you can't convert a reply chit to a substantive chit. A POI chit will just have a reply chit, and it can't be a substantive chit. That's what I'm trying to say.
Provide like a certain amount of information in a chit. I assumed it would be a substantive chit, but I'm wrong.
Yeah,
right.
yeah.
Okay.
I've seen all the information. I've taken, yeah, there were information in that chit. I've taken note of the information, but
Okay.
at the end of the day, it's still just a
Okay.
reply.
Sure.
Yeah.
Thanks.
So the best thing, if you want to like get the most of all this information, the best thing to do would be just to reply, with just to reply in short, and then writing another separate substantive chit to the executive board saying, in addition to the reply, I also want to add these points. So that way you have also sent a reply in short, and the remaining points you've included into a substantive chit as a continuation of that reply, and sent it to the executive board.
Okay. Okay. Okay.
So that way you can use all the points in your research as substantive chit. At the same time, you have also sent the reply separately.
Okay. Okay. Thanks.
Yeah. So coming next, do we have the delegate of Russia? Not yet, I guess. So delegates, I would suggest all of you to turn on your videos. I think only Bharat Biotech had a problem yesterday regarding the internet connection. So Bharat Biotech, if your internet connection is still problematic, then you can keep your video off. Apart from that, the others, if you're not facing any technical issues, or you know if your net connection is not slow, then you can put on your videos.
Hello, Ujan.
Yes,
Hello.
Anurag.
Hello, am I audible?
Yes, you
Yes,
are.
you are.
Okay. Just to make sure. Cool.
So Anurag, for today's session, will you be marking the chits, and shall I be looking into the speeches?
Not an issue. We can do that.
Okay. Okay. And so today the session will go on till 12 or 12:30. What is the time it is?
Yeah,
So
it's sort of flexible. Like 1 p.m. is the ultimate deadline.
okay.
So 12:30 is fine.
Okay, so at around 12, we will explain you two things. One is resolution, and the another is working paper. Now, none of these things are compulsory. So understand that it all depends on what the committee wants, but still we will explain it to you what a resolution is and what a working paper is. You don't have to submit either today. It's just for us to let you know, to teach you what they are, and then you can submit these things tomorrow if you want. You can also go for a different kind of paperwork. We'll explain them also, the other types of paperwork as well. Because last year in the WHO in SAMSA we didn't have any resolution. It was just a committee report that we had.
Um, Chair,
Yes, delegate.
point of personal, no, point of parliamentary inquiry, sorry.
Yeah.
What is the number of speakers on the general speakers list as of now, and what is the list?
So the general speakers list as it stands right now is we'll start with Ethiopia, then we have South Korea, Italy, and then we will have Sri Lanka.
Okay, and when will names be added to the list? Could we add our name?
Yes, in a few minutes we'll start with the formal proceedings, and then you can add your name.
Could I please speak to the ED?
Yes.
Yes.
I sent a chit in the morning, but on WhatsApp, so he has not seen it yet. So should I send it on here?
So as soon as Yash sends it, Yash will forward it to me and Anurag. So you don't have to worry about that.
Okay. Thanks.
Right. So regarding the chits,
Point
yes,
of parliament encourage you. I wanted
yes.
to know that yesterday, delegate of Germany had asked me a point of information. So the burden of proof was on her that if the claim was correct or not. So she hasn't sent me any burden of proof yet, any link as such. So shall I reply her with that statement, or shall I wait for her burden of proof?
No, no. You don't have to send any kind of reply. It was a point of order, I think.
Uh, uh, might be. I'm not sure.
I mean, it was a point of order.
Yeah, point of
Challenging.
order it was. Huh?
No,
Yes.
you don't have to. Point of
Thank you,
orders.
Chair.
You don't have to respond.
Thank you, Chair.
Okay. Regarding the chits, one thing we will do from today, if you have anything to write to another delegate, you have to send it during the committee time, that is till 12:30. After 12:30 till 9 p.m. at night, you can send any substantive chit or any chit you want just to the EB. Because what happened is that yesterday, Yash also had to organize other events in SAMSA. So what happened is that throughout the day till 9:30, he was constantly logged into his phone, forwarding chits to different delegates. So he asked me that it is becoming the load is becoming unbearable on him to log in till 9:30 and
Yes.
constantly forwarding the chits. So since yesterday was the first day, we were all sorting out the technical issues. So from today onwards, if you have to send a chit to another delegate, please write it during the committee. And after the committee, you can send as many substantive chits or as many chits to the executive board you want till 9:30. But you can't send chits to other delegates anymore. And also, if you have to send a lot of chits to the other delegates, or you have to reply to a lot of chits, just do something. Just write them down in a Word file, or if you're using Apple, in a Pages file. And then when the committee begins, you just write it down beforehand, and during the committee you just copy paste it in the chat box. So that way you will have your chits written before the committee, as well as your replies ready before the committee if you have been asked any question. And during the committee you can just send them, so you don't have to waste time typing if you think the typing is becoming difficult. So that will be the case. You can't send chits to other delegates after the end of the committee. However, you can send to the executive board as many as you want till 9:30. Okay, so since we are already past 9, I think we should begin with committee. All right. So Russia has joined us. Russia, yesterday regarding the chit that you said regarding the point of order, regarding the chit that you asked at night regarding point of order. The thing is that no, you don't have to ask a point of order or reply to it then and there. You can do it later on. You can ask a point of order, or you can sort of revert back to a point of order if raised against you at any time in the committee. You don't have to do it right after the speech. So you have all the time. You can take your time and then ask the point of order later on. But the thing is that just to keep in mind, if you're raising a point of order on a speech that a delegate made 30 minutes ago, then the fact is that that point of order will lose its relevance. So if you are raising a point of order on a speech later on, just do it via chat. If you want to do it verbally, you can do it after the speech only. Okay. So today, all right. So delegates, please respond to your roll calls. Delegate of Bharat Biotech.
Present and voting.
Okay, delegate. Delegate of Syria.
Present.
Sweden. Oh, so delegate of Sweden won't be joining us today. Delegate of Iran. Okay.
Iran, please unmute yourself and speak.
Sorry. Present and voting.
Okay. Delegate of China.
Present and voting.
Delegate of Italy.
Present.
Delegate of Oxford.
Present.
Sri Lanka.
Present.
Delegate of New Zealand.
Present.
Ethiopia.
Present.
Delegate of South Korea.
Present and voting.
Delegate of Cuba.
Present.
Spain.
Present and voting.
Delegate of Kenya.
Present and voting.
Delegate of Vietnam. We don't have Vietnam in the committee today. Delegate of Germany.
Present and voting.
Delegate of Philippines.
Present and voting.
Russia.
Present.
Switzerland. Delegate of Switzerland, your voting preference. Okay, delegate of Switzerland, just write it in the chat box. Delegate of UK. Delegate of the United Kingdom, your voting preference.
I think the UK delegate is not connected to audio.
Okay.
I'll just write it in the participants group once.
Okay. Delegate of South Africa. So do we have South Africa? No. Bit of GSK.
Don't have that either.
So delegate of Japan.
Not present.
Okay, and delegate of Pfizer. Delegate of Pfizer is also not there in the committee.
Not
So,
present as well.
yeah. So today we have with us delegate of Venezuela. Your voting preference,
Present and voting.
present and voting. So are there any delegates that we have missed? You
Delegate
can
of Philippines, I guess.
Philippines we have called. Philippines have said present and voting.
No, I've done it.
United Kingdom is here, delegate of UK.
Delegate of UK, your voting preference?
Present.
Okay. And Switzerland, your voting preference? Okay, Switzerland. So please just write your voting preference in the chat box, because we can't be having like no response in a roll call. So that is an absolute must. With that, today we have so today we have 18 delegates in the committee. So the simple majority stands at 10. So you need 10 votes to pass a motion.
Hello, I have a query, like it's a parliamentary query.
Yes.
Yesterday I got a chit. I think it was a point of information. I didn't reply yesterday. Actually, I was not able to reply. So may I or can I now reply?
Yes, sure.
Okay.
Also, Yash, if you are available, Yash, just send all the chits to Anurag sir today. If you are connected and if you can hear me, Yash, just give a thumbs up. Send the chits to Anurag sir today. And lastly, yeah, another thing, delegates, repeating what I said earlier, you can only send the chits to other delegates during the committee time. So after the committee is over, then you can send all the after the committee is over, you can send the chits only to the executive board, normal chits and substantive chits. But you can send that till 9:30, as many as you want. But if you want to send chits to other delegates or reply to other delegates, you'll have to do that during the committee session, because then that will be convenient for the executive board to forward those chits to the other delegates. After the committee is over, you can send chits to the EB till 9:30, as many as you want. Yash, if you can hear me, just send the chits today to Anurag sir.
Okay. Okay. Good
Okay.
morning, everyone. Sorry for the delay.
Yes. Okay, Yash. So if it's a reply, if you see that it's a reply,
Yes.
you send it to me, because all the yesterday's POIs are with me. But
Okay.
if it's like a new chit of today, not a reply from yesterday, you just send the chits to Anurag sir.
Okay. So,
Okay.
delegates till 12, you will text me in Zoom only. Okay. If you have any chits, you'll pass me on in Zoom, not in WhatsApp. After 12, you can send me the chits in WhatsApp just to the EB, not to any other country.
Make sure to write your names, delegates. Make sure to write your names, because no chit will be marked if there are no names on it. And if it's a reply from yesterday, just point it out that a reply from yesterday. Just write this little thing, reply from yesterday, so that Yash can filter it out and send it to me. If it's just a reply of any of today's chits, you just need to write reply. Don't write a reply from yesterday. If it's yesterday's reply, then you write reply from yesterday. Right. Delegates, at this moment, we're looking for a motion on the floor. It is motion to resume debate. Delegate of Philippines, yes. You have a Then we delegate of Philippines. Yes, please.
The delegate of Philippines would like to raise a motion with the general speaker list of individual speaker time being 120 seconds.
Okay, okay. So delegate, that motion at the beginning, that motion is not in order. So we are at first looking for a motion to resume debate. That is the motion we're looking for. And also, all the delegates wishing to raise a motion, just write your names in the chat box. That will be most convenient. So this motion is not in order. We will be taking a motion for GSL as well. Okay, so delegate of Germany.
The delegate of Germany would like to raise a motion to resume debate and establish a general speakers list for a total time of 60 seconds per speaker.
Okay, we will be coming to the GSL as well, but for now, it's just motion to resume debate. That motion is in order.
Ujan.
Yes.
Before that, just make sure that everyone make sure from now on, when you send a chit to the EB, just write it's a point of information or it's a point of order. Then you write from which country to which country. Then you write via EB, right? It's in this order. Otherwise, I'm getting a lot of chits where it just says from this country to this country via EB. It doesn't say what kind of chit it is. Some are saying inquiry, some are saying information. So I just have to be sure, right? From now on, I'm considering it. Please make sure.
Yes. Just keep that in mind, delegates. Yeah. So next we have the delegate of Oxford.
The delegate of University of Oxford would like to resume the would like to raise the motion for resuming today's GSL.
Okay. So Oxford. So Russia, China, New Zealand, Bharat Biotech, Philippines, Venezuela. So I guess this has to be the same motion to resume debate at first. So delegate of Russia, your motion.
Delegate of Russia would like to motion to resume debate.
Okay, so I think all the delegates have the same motion now, so we won't be like wasting any more time, and putting up all the motions. So voting for the motion raised by delegate of Germany to resume debate. Delegates in favor, please raise your hands. Delegates against, write your names. Okay, this motion passes with clear majority. We are back in formal session. Okay, so now delegates, ideally GSL should continue, but we can also change the total time of the GSL. If no motion is raised regarding that, we will have the same individual speakers time for GSL. Okay, delegates, are there any motions on the floor? And this is regarding the GSL. So now you can raise the motions for GSL. Delegate of Sri Lanka, your motion.
Delegate of Sri Lanka would like to set a general speaker list of 90 seconds each.
Okay, so we already have a GSL for 90 seconds each. So that motion will not be considered because it's exactly the same GSL that we are right now. Right, Sri Lanka? Yeah. Okay, so delegate of Germany.
The delegate of Germany would like to raise the motion to establish a GSL with a per speaker time 60 seconds.
Okay, that motion is in order for total time of for per speaker's time of 60 seconds. Okay, any more delegates wishing to raise a motion? Write your name in the chat box. Bharat Biotech.
The delegate of Bharat Biotech would like to resume the GSL for per speaker time 120 seconds.
That motion is in order. Per speaker's time 120 seconds. Right. Any more motion on the floor? Okay, so since we are not informed, since this is a GSL, order of disruption would not apply here, because order of disruption applies only when moderated caucus or unmoderated caucus is raised. The motion that disrupts the GSL the most is considered in the order of disruption. But since this is a motion for GSL itself, it will be order of precedence. So with the order of precedence, first we will be taking vote upon the motion raised by delegate of Germany. Delegates, all those delegates wishing to vote for a GSL for totals for individual speakers time 60 seconds, raise your hands. Against, write your names in the chat box. If you're for, raise your hands. If you're against, write your names in the chat box. Okay, okay. Sri Lanka, China, So yes, we have. Okay, so that motion clearly fails of individual speaker's time 60 seconds. Now we'll be taking the motion raised by the delegate of Bharat Biotech. Yes, delegate. So the Anurag, the motion for 120 seconds was from Bharat Biotech, right?
Yes, yes, Sujan. Yes, it was from
Yeah,
Bharat
yeah.
Biotech.
Yes, delegate of Bharat Biotech's motion. All those delegates wishing to vote for this motion, raise your hands. Against, write your names in the chat box. Okay, so 7 participants have raised their hands. Okay. So 11 against and 8 for this motion. Okay, so 11 against and 9 for. This motion also fails. So both the motion fails. So we will be reverting back to the original GSL of individual speakers time of 90 seconds. Delegate of United Kingdom, if you can hear me, just give your voting preference, whether it's a present or a present and voting. Delegate of UK.
I think Ujan, she did a present when she came back. I think she did a present.
Yes, sir, present already.
Yes, she
I
did a
just
present.
reconnected from another device.
Oh, sure. So it's Switzerland that's just remaining. My mistake. I'm sorry. Yep. So beginning with the GSL, we have the delegate of Ethiopia. Delegate of Ethiopia, you have 90 seconds. After 60 seconds, Shorodipto will give a hands up, will raise his hand. Just look out for that. And then you have 30 seconds more remaining to wrap up your speech. Delegate of Ethiopia.
Yes.
For 90 seconds.
Okay. A very good morning, Honorable Chair, other members of Executive Board, and distinguished delegates. In this time of crisis where COVID 19 continues its pace of worsening destruction, Ethiopia, an East African country, despite financial constraints, limited human resources, as well as the low level of available international support, has managed to keep its COVID 19 cases to a minimum with only 1,280 deaths out of a population of 115 million by unconventional approach. From the start, the government understood the only way to combat COVID 19 would be the public health measures taken to contain the virus's spread instead of implementing a national lockdown like most other rapid response initiated, including strict international passenger screening protocols way before since January and after mid-March when first case was reported. House-to-house screenings, diagnostic testings, and regular public awareness were crucial in stemming the outbreak. Furthermore, a strict regime of rigorous contact tracing, isolation, then compulsory quarantine and treatment have been implemented. Though lack of access to essential medicines is a tragic reality for many families, his government also this government also wanted to prevent serious damage to one of the Africa's fastest growing economies but remains vulnerable. Safeguarding these gains, preventing job losses, and ensuring farm survival was critical. Though it
90 seconds.
Yes, delegate of Ethiopia, please wrap up your last point.
though it has encouraged production and other economical activities to continue, the results so far are salutary, though we fear the worst may be yet to come in economical and health sectors. Thank you.
Okay, delegate, you have clearly exhausted your time, so no time is remaining to yield. Right. So next we have South Korea, Italy, and Sri Lanka. But before that, delegates who want to add their name in the GSL, write it in the chat box. Okay. So China, Syria. Just give me a couple of minutes. I'll take down these names.
Delicates, it would be better if you could write like China for GSL or Venezuela for GSL. Those who have written, I think it's fine.
Yeah, those
For
who have
the
written
next
fine.
time.
Cuba has already written Cuba for GSL. Right. So the list stands at South Korea, Italy, Sri Lanka, China, Syria, Bharat Biotech, Cuba, New Zealand, Philippines, Venezuela, and Germany. So next, moving to the delegate of South Korea. Delegate of South Korea, you have the floor for next 90 seconds.
Thank you, Chair. A very good morning to everybody. The COVID-19 pandemic has been one of the biggest challenges the world is facing in this century. South Korea, too, have been one of the worst affected, but not anymore. We have been able to tackle the pandemic by extensive testing, meticulous contact tracing, and integration of technology. However, what sets us truly apart is the transparency that we have maintained with our people. Accountability and transparency is necessary for the world to come together and solve this crisis. South Korea believes that all countries should be more transparent when it comes to data sharing, such that we can identify a health crisis early on and prevent it from happening altogether. I would like to yield my time to questions.
Okay, so how many seconds are remaining?
So it's 15 and 30. So 45 seconds are remaining.
Okay, so 45 seconds are remaining. We will take 4 questions. Delegates wishing to ask question, please raise your hands. So, okay. Yes, delegate of the Syrian Arab Republic.
Thank you, sir. So the delegate mentioned that transparency is one of the biggest policies that South Korea is following. How would the South Korean delegate reply to the biggest cluster of coronavirus cases due to church openings in South Korea, where the conservative Saranjil Church has been very critical of President Moon Jae-in, and this has led to a triple-digit increase in their cases since August.
Yes,
I would like to respond to that. Yes, we have had a cluster of cases in the church. However, now research is telling us that it is not primarily due to the church event, and but I don't understand how you talk about transparency not being maintained. We are very transparent. We immediately let our citizens know whenever there is an infected case, and there is a complete tracking of the infected person right from the places where they have visited and their travel history and all of that.
Okay, so delegate of Syrian Arab Republic, do you want a plea to follow up?
No, sir.
Okay. So delegate of the University of Oxford, Italy, we will also be coming to you. So University of Oxford, your question?
The delegate of University of Oxford would like to know from delegate of Syria, that what are they doing for the refugees of their country? Because we know that they are having a scarcity in the need of food and water and schools also. So how are you tackling that?
Just a clarification, Oxford. So refugees of which country are you referring to?
Syrian refugees.
Okay, so Syrian refugees in Syria.
Is that a question to South Korea?
Okay.
So it's okay, delegate. I think you have, I think you have misunderstood the delegate that is speaking right now. It's South Korea that have spoken.
Okay, sorry.
And well, so that is So I think that question won't be in order. Point of order, delegate of Russia. Yes, delegate. What is the point
Yes,
of order?
you clarified it. I raised it just before you clarified about that
Okay.
Syria and South Korea.
Okay. So I think that point of order shouldn't have stood because University of Oxford actually was not making like a factual statement or something. She was asking a question, but I also get it that it was sort of directed to the wrong delegate. So I guess you couldn't have raised a point of order there because she was not making like a factual statement. She was not saying like there are Syrian refugees in South Korea, or even in that case also it would have hard to sort of raise a point of order because Syrian refugees might be in South Korea. Syrian refugees are there throughout the world in most of the countries. So delegate of Italy, you had your question. Italy, I think you raised your hand for a question.
No, I don't have any questions. By mistake, that
Okay.
hand got raised.
So Venezuela has raised a hand. Delegate of Venezuela, your question.
Yeah, so delegate of Venezuela is a simple question for South Korea. It goes around to how the transparency has actually worked out as to prevent the occurrence of coronavirus, as to how it has created this level of stigma because of the extreme level of data being given to the people about the individual people who are getting coronavirus, right? People are now scared as to how the people who, because their data is being divulged by the media into the entire population, right? So what my question is, how do you tackle this kind of stigma that's created within people that is now showing the South Korean people are now scared to go about and test themselves because they're scared that this information might get leaked out into the public?
Yes, delegate of South Korea.
I'm not too sure how.
Do you want me to rephrase the question?
I'm not too. I do not.
No cross talking. No cross talking. Delegate of Venezuela. Yes, South Korea.
I'm sorry, but you're not aware of the fact that our country has a law which is regarding the prevention and care of infectious disease in order to carry out precise epidemiological surveys during critical high-risk states. This law was active in 2015 during the MERS outbreak, so invasion of privacy is ruled out. However, there is no stigmatization. There has been individual surveys that are being carried out by the universities of South Korea, in which the people have themselves said that they are comfortable with their information being given to the government because a greater cause is to prevent the infection from happening. We are also extremely vigilant about the kind of information that we are sharing. We do not talk about the name, the address, or the workplace address of the individual who is infected, only the travel history of the individual. Hence, there is no stigmatization, like you said, and that's all. Are people to believe that there is more? We have to pay more attention to prevention of the crisis, and we are not thinking about privacy here. Thank you.
Okay. Delegate of Venezuela, any plea to follow up you have?
No, thank you.
Okay. Delegate of Bharat Biotech, this will be the last question. Yes, Delegate of Bharat Biotech.
My question to the delegate of South Korea is that due to the tough restrictions due to coronavirus in South Korea, the mental health of most of the population, almost 40 to 50% of the population has been affected. What do you have to say about it? Because the restrictions are very tough in South Korea.
I'm sorry, but we have reopened our economy completely. I am not sure you're aware of the recent findings, and we have opened it right from August on. So I do not think this is in order, the question.
Okay, so the question is in order. I think, the points, the logic might not be.
There is a lack of information.
Okay, so I get it. So, but the question was in order. The question was, there was nothing wrong with the format of the question. So it's the delegate's personal opinion, but the committee doesn't share this opinion that the question wasn't in order. So delegate of Bharat Biotech, do you have a plea to follow up?
No.
Do you have,
Okay.
do you have any paper you are referring to?
I can send you the link if you want, because I have the link which clearly states that almost 40 to 50% of the South Korean population has been attacked by mental illness because of the tough restrictions that have been posed by the government of the South Korea.
Okay, delegates, no
thank you. You
crosstalk.
can send
No
it to me.
crosstalk, please, delegates. No cross-talking. Please send that to the delegate of South Korea via the cheat.
Okay, sure.
So your question was noted, Bharat Biotech. Your answer was noted, South Korea. Moving on to the next speaker, we will be having delegate of Italy. Delegate of Italy, you have the floor for the next 90 seconds.
Thank you. So good morning, Chair and delegates. I, as a delegate of Italy, would like to brief the WHA with the response of our nation to combat COVID-19 pandemic and share our views to improve cooperation in the international community. At first, on 31st January, 2 Chinese tourists were found positive for the virus, following which all flights to and from China were suspended. After that, 2 clusters were identified in the following week in the city of Veneto and Lombardy, where the first deaths were also noted. And those cities were labeled as red zone. On 8th March, Prime Minister Giuseppe Conte ordered the quarantine of these areas, and on following days, the entire nation, that is more than 60 million people, were placed in lockdown. The Italian ministry and law enforcement agencies were instructed to ensure and implement the lockdown. Despite all these efforts, the number of cases kept on rising each day. This did put pressure on our healthcare system. Among many measures taken, these were the few from our healthcare system. ICUs were expanded and new ventilators and masks were imported. Individual hospitals devoted to COVID were established to limit the spread. At least 10 drugs were used in different hospitals for clinical trials in different parts of country. So at present,
90 seconds.
Yes, just
okay.
wrap up your last point.
So to wrap up, if Italy was able to bring down the initial curve, then it was only due to the rigid lockdown and our efficient medical system. Thank you.
Okay, delegate, you have no more time remaining, so there is no question of yields. One more thing, yeah, I missed this. China, you've written your name in the chat box during the last POI session. So if you had a POI on the question on the last speech before the delegate of Italy's, you can send it via chat. Okay. So since there was no time remaining, I couldn't take this. I couldn't ask you to raise the question. Right. Next, we have delegate of Sri Lanka.
Thank you, Chair. Good morning, Chair and fellow delegates. Sri Lanka, a country with a total population of 21.67 million and a sex ratio of 0.96 males per female. As of now, our government has successfully controlled the COVID-19 pandemic. We have a total number of confirmed cases of 4488 and a death toll of 13. Fatality rate being 0.29% as of 9th October 2020. We were declared the 9th best country in the world in successfully tackling the virus. We started the plan early and took strong quarantine measures. Strict physical distancing was maintained. We performed maximum number of cases, that is 930 per million among the SAARC nations. In addition, Sri Lankan government closed down public health clinics and started routine health checks directly to the homes of the patient. A hotline was created for non-COVID patients as well. Sri Lanka also started a robotic treatment fast of its kind called MediMate, which allowed healthcare workers to maintain distance from the patient during test and treatment. Sri Lanka also donated $5 million in the SARC COVID-19 emergency fund. So I believe other countries should consider these steps to contain the pandemic in their countries. Last but not the least, it is true that the virus is presenting us with an unprecedented threat, but it is also a golden opportunity to come together as one against a common enemy, an enemy against humanity. Thank you.
Okay, thank you. So, Shorodipto, how much
8
time?
seconds left.
8 seconds left. Delegate
8, yes.
Yeah, delegate of Sri Lanka, we will be taking one point of information. Delegate wishing to ask.
Personal privilege.
Yes, delegate of China.
Yash, could you just take up my chat? Actually, it got sent to everyone, even though I clicked on Yash.
Yes, it got sent to everyone. I just noticed it.
I don't know how. Sorry.
I can't remove it, but okay, yeah, I'll consider it.
Note it down and then send it to the required.
Yes, I'll do that.
Okay. Yes, delegate of any delegate wishing to ask question to the delegate of Sri Lanka, Italy. Yes, delegate of Italy.
So I want to ask the delegate of Sri Lanka that recently nationwide election was conducted in the country, in your country. So what was so much necessity to conduct an election during this pandemic? Couldn't it be shifted or postponed it? That is my question.
Can I answer now? Sure.
Yes, delegate.
So I want to clarify that the Sri Lanka's parliamentary election was scheduled on April and May, but due to this pandemic, unfortunately, they had to postpone it. But as Sri Lankan government was very successful in controlling the COVID-19 pandemic, and they reduced the case to almost negligible amounts, so they could afford to conduct an parliamentary election in the month of August.
Need to follow up, delegate of Italy.
No plea to follow.
Okay, so yes, delegate of Kenya, if you have a question, please send it as a POI to Yash in chat, because we are running out of time. We won't be taking any more questions on this particular speech. Thank you, delegate of Sri Lanka.
Thank you, Chair.
At this moment, are there any points on the floor? Delegates, if you have any points, raise a hand. Seeing none, are there any motions on the floor? Delegates having motions, write your name in the chat box. Delegate of Sri Lanka.
China also.
Okay. Delegate of yes, delegate of Sri Lanka, your motion.
Delegate of Sri Lanka would like to suspend the formal debate and bring the moderated caucus of motion being discussion on increased case of domestic violence amid this pandemic, of individual speakers time being 60 seconds and a total time of being 15 minutes.
Parliamentary inquiry.
Yes, China.
I send my name first.
Yes, it was.
Okay.
It
Okay.
appeared first, then
Yeah.
Sri Lanka appeared in my chat box.
Okay. Okay, delegate of China, we get it. So would you like to raise it as a point of order, because this was a clear procedural violation? Okay, your point is in order, delegate of China. So delegate of Sri Lanka, I'm sorry, we have noted this, but you'll have to raise it again. We'll be taking China's first. So delegate of China, your motion.
The delegate of China would like to raise a motion to move into an unmoderated caucus for 10 minutes of duration.
Okay, and mod for 10 minutes. Okay, delegate of Sri Lanka. So
yeah, I will tell another time.
Yeah, 1 second. Just Yash, just clarify. Is Italy has Italy raised after China for a motion?
Wait, let me check. Just get me. Yes, it was after Sri Lanka.
It was okay. Italy, it's for Italy for GSL, I think.
It's Italy for GSL.
Yeah, and the previous one is Italy for point of information on the previous speech. I think Sri Lanka's speech.
Okay, thank you, Shodadipta. Thank you, Yash, for this clarification. Okay, so next, delegate of Sri Lanka. Now your motion, sir.
So delegate of Sri Lanka would like to suspend the formal debate and bring the moderated caucus of motion discussion on increased case of domestic violence amid the pandemic, of individual speakers being 60 seconds and a total time being 20 minutes.
Okay, that motion is in order. Delegate of South Korea.
The delegate of South Korea would like to move into a moderated caucus of total time 20 minutes with individual time 60 seconds on the motion healthcare workers infected in the COVID-19 pandemic.
Okay. Okay, that motion is in order.
Point of personal privilege. I think I messaged privately to the chair Yash, I think.
Okay, regarding?
I wanted to raise a motion. I was after Sri Lanka.
Okay, but okay, so you send him privately. I get it.
No, I did not receive any check. After Sri Lanka, it's Italy,
Okay, Germany, we'll be recognizing you. We'll be recognizing you. But from the next time onwards, send if you like want to raise a motion, just send it to everyone category. So for now, we have to take Philippines and New Zealand first because they have sent it there. Right, delegate of Philippines, your motion.
The delegate of Philippines would like to suspend the formal debate and bring the moderated caucus on the motion of impact of COVID on conflict and war-inflicted countries, with individual speaker time being 90 seconds.
And total time?
Total time 20 minutes.
Delegate, 90 seconds and 20 minutes. Is
Oh,
that
sorry,
feasible?
15 minutes. 15 minutes. Sorry,
Okay.
15 minutes.
I get that motion is in order. Delegate of New Zealand.
Delegate of New Zealand will just a second. Delegate of New Zealand will like to suspend the formal debate and start a moderated caucus on motion for social and mental health of an individual during the pandemic for 90 seconds each speaker, total of 15 minutes.
Delegate of Germany.
The delegate of Germany would like to suspend formal debate and raise a motion on aim to increase economic activities by signing more trade contracts and inviting foreign investment to improve job opportunities in the time of pandemic.
Okay, can you just repeat the total time and individual speaker's time?
Total time 10 minutes, individual speaker time 60 seconds.
Okay. Okay, so Russia, your point of parliamentary inquiry. You had a point of parliamentary inquiry.
For the motions which you raised, it was like from Sri Lanka, then we went on to Philippines, but like here it shows in my message chat that it was South Korea or something.
Yeah, we have taken South Korea.
Okay.
South Korea, we have taken the impact of COVID on healthcare workers, total time 20 minutes, individual speakers time 60 seconds.
Okay, thank you.
Yeah. So delegate of Cuba, your motion.
Thank you, Chair. The delegate of Cuba would like to suspend formal debate and enter into a moderated caucus on the topic of strengthening primary health care and mobilizing the primary healthcare system in developing and underdeveloped countries in the fight against COVID-19. And for a total time period of 20 minutes with individual speaker time of 60 seconds.
Okay.
Thank you.
Right. So we have a lot of motions in our hand right now. Obviously, only one will get passed, and the remaining won't get. Remaining will obviously will not be considered then. So that's
Point of person privilege.
Yes, delegate.
So when we are voting on the motions, could you also state the topic of the mod caucus, because there's a lot of motions in it.
Absolutely,
Okay,
absolutely.
thank you, sir.
Thank you. Okay, so the first we'll be voting the most disruptive, that is the unmoderated caucus. The delegate of China has raised an unmoderated caucus for 10 minutes. Delegates wishing to vote for this motion, raise your hands. Against, write it in the chat box.
Sri Lanka is against. Yes, private.
Point of information, what was the topic of China's debate, moderated caucus?
It's an unmoderated caucus, so it doesn't
Acha,
have any
unmoderated.
topic. Yes.
Acha, unmoderated. Okay.
Yes. So we have 13 votes. We are waiting for the others to respond as well. Now we have 15. 16, 17. Okay. We have 17 votes. We are still looking for 2 more votes. Okay, just one clarification. Are there any delegates who have not given their roll call today, who have joined later? Any delegates? Just please unmute yourself for the time being and just give your preference. Any delegate who has joined later and have not given the voting preference? So by that count, there should be 18 delegates in the committee, but I'm getting 17 votes for some reason. I don't know.
I think United Kingdom joined later.
Yeah, UK has given a voting preference.
Switzerland,
Yeah,
present and voting.
Okay, Switzerland also I have taken note. One, 2, 3, 4, 5, 6, 7, 8, 9. Okay, so with 9 for and 8 against, this motion passes. However, delegates, I'm seeing a lot of you are not voting. At least 2 haven't voted. A lot of you have voted, but 2 haven't voted. So I think this shouldn't continue. We should all vote because you can't abstain from procedural voting. For the time being, this motion passes of the motion from China, that is motion for an unmoderated caucus for 10 minutes, it passes. Now, the fact is that the remaining motions, Sri Lanka, South Korea, Philippines, New Zealand, Germany, Cuba, these motions fail. These motions won't be voted for now. However, you can still raise these motions later on by just changing the time, or you can just tweak the words a little bit so that the motion remains the same, but the wordings or the time just changes, so it becomes a new motion. You can raise them again. Don't worry about it. Somebody raised their hand. I think Cuba raised her hand. Delegate of Cuba, you raised your hand right now?
No, that was my mistake.
So, Chair, I have a parliamentary inquiry.
Yes, Sri Lanka.
In the chat, I'm saying that Spain is having some network issues. So, did Spain vote?
Let me see. Yes, Spain voted.
Okay, thank you.
Spain voted. So, okay, we are in an unmoderated caucus for 10 minutes. So, Shourodipto, Yash and Sahasra, you stay in the committee. Anurag and I, we will leave for 10 minutes. And after 10 minutes, we will again return back to the chat. For the time being, delegates, all of you should speak in this moderated caucus. However, just make sure that one of you is speaking at one time. If you all unmute at the same time and speak together, there will be a huge ruckus in the committee. And so Shourodipto, Yash and Sahasra will be there, to make sure as the host and to let us in later on. So for the time being, Anurag, let's leave the committee for 10 minutes now. Is it okay? Anurag?
Yeah, okay.
Okay. So we're leaving for now. Shourodipto, Sahasra and Yash, you take over as the host. And
Yes.
Let them speak. We don't need to moderate this session anymore.
Yeah.
Okay.
Okay, delegates, am I audible?
Yes.
Yeah, you're audible.
Yes, you are.
The reason I actually had this was because ideally tomorrow we should be passing a resolution. Right now,
Exactly.
to pass a resolution, we need to have 2 topics which we need to discuss in a moderated caucus. First is obviously vaccine, and the other one is the previous legislation which is already there in the WHO, which is the response plan. Okay, so obviously we'll have 2. I would ideally suggest we should have at least these 2. Look, we have companies.
Exactly. I mean, we're focusing on country-specific procedures. I don't think that's necessary for this committee.
We need to try to pass one moderated caucus. It doesn't matter who passes it, obviously, but one person pass it on vaccine, and one person after vaccine needs to pass it on response plan. And I think response plan has to be the last one, because tomorrow we should move into ideally a discussion where we have a resolution in place. Now, since we have more time, because both of these, considering we take them for 20 minutes or 25 minutes, we can still easily pass a third moderated caucus. Now, everyone has their own types of, everyone has their own suggestions for this third moderated caucus, right? Everyone wants to discuss their own. So what I would suggest was that in this unmoderated caucus, let's use it to decide on one thing which everybody will vote on. Okay, I will give my suggestions. All the other delegates after me, please give your suggestions, and then everyone can just give their opinions on the third moderated caucus. Okay, so we can discuss what the moderated caucus right after this unmod will be, and then ideally after that we have to discuss the vaccines and the response plan. So does anybody have a problem with discussing vaccines and response plan?
I think vaccines would be too blanket of an issue, because honestly, we're weeks away from actually getting. The thing is, we need to set up supply chains. That's the important thing.
No,
We need to think about.
When I say vaccine, obviously I do not mean discuss or moderated on vaccine. Obviously, when I say vaccine, I mean passing a moderated caucus on distribution and production.
We need to, the developed countries need to come together and at least find out a way we can help out the lesser developed.
For that, we need to have a moderated caucus, right? Now, after that, the last moderated caucus should be to discuss some legislation, which is the response plan, right? And whoever raises the motion can pass it in whichever wording they want, but ideally it has to be something regarding the resolution.
Something that leads to the resolution. That's right.
Now, see, what we should do is we should keep one moderated caucus for every country to state whatever problem they're facing. You know, from whatever point of view. For example, if you have refugees, then you can state whatever your problem is. Then what you can do is you can move to vaccine. Then you can move to vaccines, and then you can move to the global response plan. What you're saying. And what we can do is inculcate the problems that were stated in the first moderated caucus in the third moderated caucus.
No, but that would be too specific a thing, like the country specific, like refugee problems.
No, I'm saying on the global level, what would we say?
I understand delegate of Syria, but we need to have some topic of discussion so that the whole committee is discussing something be part of. Because I cannot be talking about college, whereas someone else is talking about mental health, whereas someone else is talking about lack of money, right? So what I would suggest was either we can discuss something like how to prevent future infections, or obviously
that's a good topic, because we can all pitch in.
And
ideally, we have to create a body that would monitor the healthcare workers, because they are at the crux of this entire situation.
Okay, so one is future. This topic by South Korea is also a good idea. We could discuss one on healthcare workers, because that is also a common topic, because all countries.
So what would that do? What would that body do? What would that body do?
They would monitor the healthcare workers, their health, and they would intervene whenever there is a blatant,
Delegation of New Zealand would like to say that vaccine has a long way to go. Like, it is not yet in the market, and we don't know how much time it is going to take. So it's very important to discuss at this moment that what we should do for rapid testing and how we can actually prevent without vaccine, how we can face
the
this
point
COVID-19.
The vaccine is that we as countries at the WHO need to have a plan in order for when it
The delegate of Sri Lanka would like to speak. Excuse me.
Yes.
Yeah, go ahead.
So, as every country is facing this problem of increased rise of domestic violence, so I would like to make this a moderate focus.
This is why I was saying we should have a moderate caucus. This is why I was saying, because a lot of people, a lot of people would say that
I realize that domestic violence is.
I understand what you're trying to say, but the thing is that there are a lot of countries who have already faced the pandemic and are in a phase where they're recovering. Like like South Korea.
See, that's all well and good. You're recovering, that's well and good. But there are countries that are not recovering. There are countries like India, there are countries like Syria and Kenya that are not recovering.
Kenya may transfer, but you can reclaim maybe.
Or healthcare worker welfare.
At this point, preventive measures, countermeasures would be the ideal topic, because everyone can pitch in with whatever they want.
I agree with delegate of Syria, because vaccine development issues are already going on in WHO, and different countries are already trying to get a new vaccine, and measures have already been taken. But at present, what we need,
we're not actually saying that we need to develop a vaccine. We're saying
vaccine.
How would we supply it to everyone?
Yeah,
How do we supply it
For
to
that,
everyone?
first there is a need to come a vaccine. We don't have vaccine at present. All
I
countries
think
are just making
Russia,
an effort
but
to
Russia
prepare
is
one.
on the phase 3 of vaccine making.
Yeah, and there are
Many vaccines are in phase
I think
3.
Russia
Many
could
countries have developed.
right.
Many countries have developed vaccines that are in phase 3 right now, and or are waiting for phase 3 approval.
However, the cost of the vaccine.
There were vaccines that failed phase 3 as well.
Yeah,
at past there were vaccines that failed
Guys, please, one at a time. It's getting very haphazard, please.
Okay.
One at a
I
time.
can't hear anyone.
Go ahead,
New Zealand.
New Zealand, go ahead. New Zealand, you were saying something. Finish it.
Yeah, go ahead.
My point is that at past there were vaccines that failed at phase 3, and we are not yet sure that the vaccines which are at trial at phase 3 is going to succeed. So there are obviously measures going on. At present, what is the most important thing is we need to prevent, we need to learn how to survive with vaccine, because it is going to take more than 6 months or 7. At this point of time,
we agree with you.
All of us need to use this period to prevent further infections. Like each day there is rise.
The delegate of Philippines would like to say something.
One second. Philippines.
Delegate of Philippines.
Okay, let's make an order. 1 second. Could I just after which
Philippines, go ahead. We have spoken for the entire mod. Go ahead.
Yeah.
I'll just reply.
I was just suggesting that there are many vaccines that are under phase 3 trials, and I think that we should develop some action plan beforehand so that we don't waste any time when vaccines.
The thing is, we've already agreed upon the preventive countermeasures moderated. So the next one would be what you guys want. So we're discussing after that. What do we jump straight to a response plan, or do we keep a moderated caucus to see if we should inculcate vaccine development into our
moderated caucus on how the action plan, how to supply the vaccines.
That is the last moderated caucus we are planning to have.
Okay. That's fine.
China, the thing is, you can also the vaccine supply and demand thing, you can also include it in the final one. You don't need to have a separate moderated caucus for it. You can include it in the points.
I'll tell you the only reason. We have companies which manufacture vaccines in the committee. So we should include them and have a moderated caucus to discuss every country's response plan, which country is going to buy vaccines from which country, and how we're going to actually supply them. Also, I don't know if everyone read the background guide, but the background guide pretty much said that you need to ideally figure out a way to do mass distribution and to produce the vaccine. So I suggest we should discuss vaccine. Along with this, I would also suggest everyone to please suggest the other modcoc that we want to pass after this. We have already got 2 options. One is to discuss future infections. The other one is to discuss healthcare workers. If everyone else has other ideas, you please suggest, and we all.
I already suggest increased risk of domestic violence, and it can also be regarding the mental health issues. And today we also
realize that mental health is an important issue, but right now we cannot make a resolution based on.
So yesterday we had a moderated social disruption.
But the government can take some steps regarding this time.
Sri Lanka, I understand your point. The thing is, what if we give a moderated caucus about identifying problems on the global scale and then solutions and counterproductive measures, right? So what this can do is you can state what problem you're facing and then what we as a committee can do to help you, right? So this can be the topic for the immediate moderated caucus that we would have. Identifying problems on a global scale and then developing solutions to. Yeah, go ahead.
I was saying Sri Lanka's problem, however, is we realize that mental health and domestic violence are pressing issues, right? We realize that coronavirus has exacerbated these problems, but these are problems that have existed nonetheless.
Right.
So discussing them on such a ground won't really bring a lot of.
Also, I would like to point out that we had caucus on mental health yesterday. I do not.
Yeah, we did.
Moderated caucus again and again. We discussed social disruption, closing of schools, and what effect it has.
So I think primarily preventive countermeasures would be the ideal thing to discuss.
We have the delegation of China. delegation of China. Yesterday, we didn't discuss much about mental health as far as I believe. It was more on schools
and colleges.
Colleges
Guys,
opening.
guys, you're
It's totally
wasting
different
Point
time.
of order, I think.
Yeah, guys, we don't have a lot of time.
You can't do point of orders in unmoderated
Okay, I'm so sorry.
I'll tell you the topic.
I believe that this issue is common to all the nations, this mental health and domestic violence
Another
issue.
thing I'd like to add that the vaccine development has also come under radar. I mean, a lot of problems like Russia has not been transparent with the number of people they have tested. And
There's a lot of vaccines that have failed.
As less as
Delegates, time is up.
76.
Time is up for the unmoderated caucus. Time is up for this unmoderated caucus. I can
Guys,
see.
do we ask for extension?
Yes, obviously you get that option for extension.
Thank you, sir.
I can see a lot of you are like most of you here are pumped up, had a discussion. So right, delegates, ideally since we will be having only till 12:30, we will be looking for other motions like other moderated caucus and stuff. But if you want to raise an extension, you can. So delegates, are there any motions on the floor? Write your name in the chat box. China. Delegate of China, your motion.
Germany. After that, China. After China, it's Germany.
Okay, China, Germany, Syria, New Zealand. Okay, delegate of China, your motion.
Sorry to interrupt, but please, if you want to pass for a motion, please send your message in the everyone chat.
Yeah. Germany, please send it to everyone chat.
Yeah.
Okay, so we have recognized you after China. Yeah, so delegate of China.
The delegate of China would like to raise a motion to move into a moderated caucus for speakers time 1 minute for 15 minutes on the topic prevention of future infections of and other virus outspreads in the future.
Okay, but for that we need to return back to the GSL, right?
We can suspend unmoderated caucus and move into a moderate caucus if that's
No, we can't.
Okay.
After any kind of moderated or unmoderated caucus, we have to return back to GSL first. Okay, delegate of Germany, your motion.
I'd like to raise a motion to extend unmoderated caucus for a period of 5 minutes.
That motion is in order. Delegate of Syria, your motion.
It's a motion similar to Germany.
Okay, delegate of New Zealand, your motion.
It was a similar motion I wanted to raise as that of Germany.
Okay, delegate of Sri Lanka, your motion.
Motion to set the general speakers motion to return back to the GSL.
Okay, we don't need a motion for that. That will be automatically activated. So that's
okay,
the automatic procedure. Okay, so we have just one motion from the delegate of Germany. Motion to extend the moderated caucus by 5 minutes. Delegates wishing to vote for this motion, raise your hands. Against, write your name in the chat box.
Hands raised.
Yeah, I can't see any hands being raised.
15 hands.
15 hands are raised? Oh.
Yeah.
Okay, then this motion passes. I actually couldn't see any hand because I don't know why. Okay, so if 15 hands are raised, then this motion passes. And so we are again leaving for 5 minutes.
Yes. But guys,
sorry to interrupt you, Anurag, but IT team needs to make the chairperson's co-host yet again after they rejoin. Just a note to the IT team. Then only they can see the hands.
I'm so sorry, I'll just do that.
I have a point of personal privilege.
Yes.
The chats that Mr. Yash sent me yesterday, they had no names of the delegates, those who have sent it to me. So I don't know whom to reply. I can reply that from the delegate of Bharat Biotech to via the EB, but I have no idea who has sent those chats.
Yeah. So
it was from Germany. Please make sure that from next time you write your country name, the chats to
I have
you're
got
sending
6 chats.
It was all from Germany.
All from Germany, okay.
Okay, and delegate of Bharat Biotech, you have also sent all the replies to Yash, but Yash, you have also not mentioned your country's name.
Yeah.
The reply to Yash, sir. So
you don't know the Germany's name, but you know your country's name, but still you have not
Yes.
written your name also.
Yeah. Thank
Okay.
you.
Okay, so we are leaving delegates who are speaking a lot. Please, allow others to speak as well in these 5 minutes. All right, we are leaving.
Okay, guys, can I speak?
Okay. Yeah,
Can I
Germany,
speak?
go ahead.
Yeah.
New Zealand would like to say that 7 to 8
New Zealand,
months.
let Germany speak for a minute, please.
Let Germany speak.
Germany, go ahead.
Okay, so we need to come up with a solution, and we're only thinking on the medical front on how to prevent further infections and how to deal with vaccines and all that. We need to come up with an economic solution as well, and we've not talked about that at all. Because this is the WHO, I get it. We're going towards the health aspect, but it is supposed to
Delegate
be
of
on how to move
Germany,
forward.
delegate of
Yes,
Germany,
I
I would
also
like
agree
to
with
say
Germany.
if health is wealth, if health is under control, then definitely we can
Ma'am,
handle our
What would
economy.
that mean?
that's an English
so
proverb,
guys,
please.
The discussion on response plan is a holistic
Sick
discussion.
plan, yeah.
All discussion. When I said
No,
response
yeah,
plan,
I am with Germany.
economic aspect. It's not
Yeah,
just
we need to discuss something about the economic plans. Yes,
Yes.
because
And can we
because-
come up with ideas for other aspects as well? There's economic, there is health, there is the future plans, but can we come up with more topics for more?
we can have excuse me,
that's the
we can have a
Good
moderate
goal,
focus
sir.
of some topics like which will be the first priority, the health or the health or the occupation of people.
Germany, the response plan is a holistic discussion which we've all, I think, decided on will happen for sure today.
Okay.
Exactly. We don't need to waste
Delegate of
Take-
Sri Lanka, I would
Yeah.
like to say that health and wealth, both of them are really important. We can't compare both parallelly.
Yeah,
Like we need to
that's a
focus
common
equally
problem.
on both the problems. We can't compare both of them.
Okay,
but
guys,
if
we have
we
5
make
minutes. Sri Lanka,
if we control the if we continue the lockdown like this and allow and force the people to stay in the homes, then economy will break down, right? So then
that's the
automatically
beauty.
everyone
That's the
will
beauty
suffer.
of the World
You
Health
are
Assembly.
speaking
Sri
for
Lanka, you
yourself.
can do whatever you want, right? You can do
You
whatever
are
you
speaking
want,
for yourself.
whatever your country wants. This is not a global thing.
I guess let other people apart from China, Syria, Germany, New Zealand to speak if they have something to say. I guess Spain was saying
excuse me.
Pina.
Yeah.
Yes, I want to state that Germany has raised a point, and I would like to specifically say that each country has a tailor-made or should have a tailor-made or a custom-made plan to reopen their economy as well as their educational sector. And I think we should have a discussion and pass a resolution on this based on the infectivity rate as well as the test per million or the increase in the, and I think it is the very important part with respect to the response plan that we are all talking about. So
And I
would
have something to add to Kenya.
Go ahead.
What you said is totally right. I support that, but each country has different requirements. Not all country can follow the same protocol. So I feel that each country should have there should be a common goal, but each country should have different their
Exactly.
particular goals.
Yes, I agree with you, but at the World Health Assembly, we can pass a resolution, means we can divide the countries according to their infectivity rate, like the positivity rate or test per million done, and then or
Delegate
their
of Kenya, there can be something we can increase number of rapid testing kits, and we can go for testing measures more and more to cover maximum population and subsequent reach of herd immunity that we can get.
Okay.
Yes,
We can
this is
increase
But
rapid
delegate of
testing
Oxford
methods.
wants to tell that I guess since we are a World Health Assembly, we need to emphasize on the fact of health more than economy, because this is the topic that only we can deal with and no other committee can deal. So I guess we should be giving importance to that, our health and how can we prevent the post-infection
I
and
agree
everything.
with University of Oxford, and we should increase more and more rapid testing
Right.
methods.
That's-
We should
that's all
cover
well and
maximum
good.
population that is possible. And
Guys,
Guys, let's not get into
okay.
technicalities.
Yeah, that's all well and good. Let's just decide the topic for the moderate caucus immediately. We have like 1 minute to decide. Are we all set on preventive countermeasures
Delegate
and
of Italy
what
would
to do?
like to say something.
Yeah, Italy, go ahead.
A topic was raised on the death of frontline worker for the moderated caucus. So Delegate of Italy feels that it is the best topic to talk about in the unmoderated moderate caucus, because in many countries there is a huge shortage of PPE kits, and
100%.
nothing much is done to take care of the healthcare workers. So it would be
100%.
best to pass a resolution that WHO would provide
Create
or
a body.
sponsor PPE kits from the
Yes.
countries producing in masses to the countries which
See,
are
the World
lacking.
Health
I agree with
Organization
you.
already does this. The World Health Organization already does this. They just
Exactly.
say that given
It
2
should be
million
under the
PPE
I
kits
have
topic
the
of.
a year.
same point as Syria.
However, there is
So
no
it should
monitoring. We have to
It should
There
be
is
under
create
the
a
topic
monitoring
monitoring
of.
body.
body.
Delegates
Individual
from a
countries should
note from the
take measures for
EB.
this.
Delegates note from the EB. I'm sorry, but your time is up for the unmoderated caucus.
Okay, sir.
Yes, delegates, your time is up. Anurag has joined.
Not yet. Not yet. He hasn't joined yet.
Okay, so just wait a minute or so. Let him join. Where is Anurag? Okay, meanwhile, any of the delegates want to summarize what happened in this 15 minutes unmoderated caucus? Just raise your hands. This is informally. Delegate of New Zealand. Yes.
Yeah, all the countries had their own points. Some wanted health, topic of health to be discussed, and others were in favor of wealth discussion, economy discussion, and few of them also wanted PPE kits and healthcare workers to be given importance in terms of the problems they are facing. They want to discuss things about them. They want that World Health Assembly should give something like to provide them with PPE kits and basic requirements. In short, we didn't have anything at conclude. Everyone were just discussing, and it was more of a very informal conversation.
Yeah, I get it. That is the nature of it. Yes, delegate of China.
Nothing. We actually all agreed upon one thing, which is that everyone is wanting to discuss a response plan at some point today at the in the in the form of a moderated caucus, so that all the countries tomorrow can move into something like a resolution. And the rest of the discussion was on what other moderated caucuses we would like to all pass together depending on the different countries. Like some countries wanted to discuss issues regarding some countries are still facing the pandemic, so that is why they wanted to discuss issues such as lack of supplies, lack of kits, whereas other countries obviously wanted to discuss rebouncing their economy and recovering the economic aspect. But yeah, that's it. We all just agreed on the response plan, which is a positive from the unmod.
Okay. Delegate of Syria.
Basically, what China said, I think a lot of countries wanted to discuss contextual approaches, what their country wants to do and what their country will do. But yeah, we did agree on a global response plan that we need to formulate as a committee so that we can move into resolution passing as of tomorrow. So that was a positive, but I think a lot of countries are fixating on their own issues and they're not understanding that the World Health Assembly deals with issues on a global scale.
Okay. Thank you, delegate of Syria. So moving forward, we will be returning back to the GSL as there can't be an extension on an extension. So next speaker on the GSL is the delegate of China. Delegate of China, you have the floor for 90 seconds.
Thank you for the recognition, Chair.
Yes, delegate.
Am I audible?
Yes, you are.
Picking up from my first GSL speech, China has been a leader in aiding other countries in multiple avenues. China has demonstrated humanism by helping countries with not just those which we have strong relations, but also other countries as well. The best example of this is China sending medical supplies to the Vatican. Government of China has in fact even asked that the country if they wanted more supplies and how we could help in epidemiologically decreasing the number of cases in the country. China's policy with regard to global medical aid is one in which China believes that viruses respect no border, race, no religion, and the coronavirus is the common enemy of humanity. Another important fact to note is that China pays around 57 million to the WHO, which is the highest any country pays since US has withdrawn from this organization. I think that China thinks that all nations should take note of this and understand as well as appreciate China's efforts on a global scale to help world health, unlike many other countries. China hopes that this committee doesn't partake in pointing fingers at countries and hopes to build a comprehensive plan together to reduce the global death toll. I would also urge nations with monetary advantages to come forward like China and help countries in need and follow in China's footsteps to aim for a corona-free world. This is not the time to get into diplomatic debates, but to show compassion and save innocent lives. Thank you.
Okay. Shorodipto, how much time is
6
remaining?
seconds left.
How much?
6.
Delegate of China, how would you like to use that time?
Questions.
Okay, just one question on the speech of Delegate of China. Delegate of Germany, yes.
Germany mentioned that China mentioned, the delegate of China mentioned that it sends high amount of exports to other countries in the form of PPEs and vaccines and whatnot. But it has been met with high complaints as to the inconsistency of the products and their low quality and non-functionality. So how would China like to respond to that? Have you done anything to improve your products?
Firstly, China would like to mention that this is free medical aid that these countries are complaining about. China obviously maintains a very high standard with respect to its medical equipment. We have very less amount of medical professionals infected because of this high quality maintained. And any countries which have issues with the medical equipment, we have addressed and are currently addressing regarding a lack of quality in the masks or the PPEs. That being said, they are all quality tested and we are further testing them in case there is some defect in manufacturing.
Lee, to follow up?
Yes, Delegate.
As you were talking about the medical aid, I'm talking about pre-ordered medical equipment and not free medical aid as well. And also there have been high complaints of redirectment of materials and them reaching at a delayed point to countries that have pre-ordered them. I can provide the proof through a link soon, but yeah.
The case when it comes to ordered equipment, the ordered equipment, China does not manufacture under its government, but it loans it out further to companies. And if there are any issues regarding the equipment, then China is happily willing to take it up with those particular countries who are manufacturing the equipment. China, the government themselves is not undergoing this procedure and are happily willing to take up any queries regarding it and take it up with the company to compensate the others for the same.
Delegate of China, one clarification. The government doesn't manufacture, you're right, but the regulatory mechanisms and the standards are set by the government only for the companies to manufacture. Yeah. Now, if the companies are not meeting those standards, then it is definitely the responsibility of the government to provide accurate regulatory mechanisms. So in that respect, if the companies are failing to meet those requirements, the burden lies on the government itself, despite they are not producing them.
I pointed out how China is willing to take up the issue with the companies and compensate them for the same.
Okay, Delegate. Okay, noted. Okay, Delegate of Venezuela, South Korea, and Kenya, we don't have any more time for this speech. So please, as Germany typed her name first, we had to recognize her. You can definitely send your questions via chat. We will be marking upon them. Okay. Or you can address the questions to China in your own float time. That can also be done. Right. So the next in the GSL, we have Delegate of the Syrian Arab Republic. Delegate.
Yeah. Am I audible?
Yes, you are.
So delegates, I think you're fixating on national issues rather than fixating on global issues in this discourse. See, the thing is that there was a document released by the World Health Organization on 24 June titled Critical Preparedness, Readiness and Response Actions for COVID-19. And it has already described what countries can do according to various scenarios. It has described 4 scenarios. It described countries with no cases, sporadic cases, clustered cases, and countries with community transmissions. And it provides guidelines for each country so that they know what to do depending upon how many cases they have. Right. So what we can do is we can use this for at our own national level and come up with policies for this. Now, a novel approach that we can take is, for example, released by the World Health Organization is a COVID-19 essential supplies forecasting tool. This is designed for countries. What we can do is we can scale it down for individual health centers so that they can tell us the amount of COVID cases they have, and according to that, the supplies they would require by the government. This would give the country's government a head start as to how many PPEs and how many supplies they need. Right. What we can also do is we can also make a specific tool for health institutions, public institutions like schools, so that in case there is an outbreak or in case there is a single case of COVID detected, we already know how many PPEs they would require and how many testing kits they would require. Right. Now, the second thing that we need to discuss as a committee is we have to
90
identify
seconds.
I'll just sum up the point. We have to identify probable pharmaceutical agencies to scale up vaccine production.
Okay. Delegate, clearly you have exhausted your time, so there is no more time to yield. Next, we will come to the next speaker, that is the delegate of Bharat Biotech.
Excuse me, I have a point of parliamentary inquiry.
Yes, delegate of New Zealand.
Is it possible for me to add my name to GSL list at present?
Yes, you want to add it? Okay, I've
Yeah.
written it. Okay, I've written it.
Thank you. Thank you.
So
I have a point of parliamentary inquiry as well.
Yes, Venezuela.
So Venezuela, is my name added to the GSL?
Yes, absolutely.
Thank you.
So you're the second last speaker on the list. So it's Venezuela, then Germany, and New Zealand just added right now. So it's Bharat Biotech, Cuba, New Zealand, Philippines, Venezuela, Germany. Oh, sorry, New Zealand. Your name was already added. So
Okay.
It can't be added twice. So
Okay,
your
fine.
name is already there.
Parliamentary inquiry. Italy's
Yes.
name is also there in the GSL. I guess I messaged it in the chat.
Yes.
Way back.
Italy, your name was not added previously, but now we
I
are.
was there. I messaged at the time. I will tell you the time.
Yes, it was Italy for GSL.
Okay. Yeah. Italy. I remember that. So after Germany, your name is there.
Germany.
Point of
No, my
parliamentary
name
inquiry.
is after. Okay, Germany. Okay. Thank you.
Yes. Delegate of Kenya. Yes.
Yes, the cheat, I have sent a cheat to a country and they have replied me. So can I further send, means I can appeal on that?
Appeal, I mean, if you have any if you want to challenge their reply, you can obviously write them multiple cheats, another cheat or multiple cheat, saying that their cheat is logically wrong or anything, or they're factually wrong. You can do that, absolutely.
Okay. And it will be via EB, right?
Yeah. If you want us to mark on that, send it by.
Okay.
Bharat Biotech, yes, ma'am.
The suffering of world cannot be estimated in the present time. In yesterday's session, many delegates were busy advocating what their country has already done in the past 10 months. But I, as the delegate of a pharmaceutical company, feel that the need of the hour is to acknowledge what we need to do next, rather than focusing on what we have already done. Many universities and companies like us have come forward to prepare vaccines to combat this pandemic situation. Most of the vaccines have already entered phase 3 or are waiting for approval for entering phase 3 trials. We ourselves have developed 3 vaccines simultaneously, the Coroflu, the Covaxin, and the Corovax. All these vaccines are based on different principles, like the Coroflu is based on M2SR, which is an influenza strain that triggers the immune response of the body and is a nasal vaccine. And currently we are preparing about more than 300 million doses of the Coroflu vaccine for global distribution. Even the Covaxin, which is our indigenous vaccine, is an inactive vaccine developed from the Indian strain of novel coronavirus that has been isolated by the National Institute of Virology, Pune, India. We have completed the phase 1 trial of Covaxin in just 50 days, rather than the usual time of 3 months that are taken for other vaccines. And the last one is Corovax, which uses existing deactivated rabies vaccine as a vehicle for coronavirus proteins. So I urge all the delegates to come together and support the various companies and universities that are trying to make the vaccine as fast as possible
90 seconds.
and help us to bring the sense of normalcy again. Thank you.
Thank you, delegate. You have exhausted your time. So next in the list, delegate of Cuba.
Thank you, Chair.
Yes.
Good morning, delegates of the House and honorable chairpersons. The COVID-19 is a global challenge which does not distinguish borders, ideologies, and levels of development, and is also testing health systems around the world. But its most devastating impacts, both economic and social, will be lethal among the most vulnerable, that is the underdeveloped world, and also those in the pockets of poverty of the industrialized countries. So with a decade-long experience of facing terrible epidemics in Cuba, the Republic of Cuba immediately implemented a national plan, which is developed in line with the protocols established by the World Health Organization. The implementation of this plan is supported by our free and very resilient health system with 9 doctors per 1,000 inhabitants, providing 100% coverage, and also a medical and pharmaceutical and biotechnological industry providing innovative products for treatment of the disease. And thanks to this, we have been able to see a considerable, because of a favorable evolution of the pandemic with only 5,917 cases and 123 deaths. Without neglecting the responsibility to protect our own people, we have not abandoned the Cuban Revolution's vocation for solidarity. We have sent approximately 52 medical brigades to 26 countries and territories hit by COVID-19. No single country can fight this pandemic alone, and also a global response based on unity, solidarity, and renewed multilateral cooperation is required. Cuba calls upon the international community to put aside personal differences and also come together to seek solutions jointly, especially for the vulnerable, that is the underdeveloped world and the developing countries. So with this, the delegate
90 seconds.
Yeah, with this, the delegate of Cuba would like to open the floor for questions.
No, delegate, you have totally exhausted your time, so there won't be any time remaining for you to yield to questions. So we won't be taking any questions. But obviously, if delegates have questions on the speech of any particular delegate, even if they have exhausted their time, you can still send these questions via chat.
So point of parliamentary inquiry?
Yes, delegate of Syria.
So points of information sent via chat would have the same weightage as points of information asked after the speech, or?
No, delegate. Verbal points of information will have more weightage since they are being asked openly to the entire committee. However, if you write it as a cheat, it will be treated in the merit of a cheat, the point of information for a cheat.
Thank you, sir.
Yes. So now, delegates, at this moment, are there any
point of parliamentary inquiry?
Yes, delegate of Italy.
Since this is an international platform and Italy has many questions to ask from India, USA, and such countries, but the delegate of these countries are not there. So where should we post those questions?
You can't ask them directly to US, to India, because then that check will become void because they are not in the committee. You can do something. You can, if you have questions, if you want to raise questions or allegations on countries that are not present in the committee, write them as substantive chits and send them to the executive board. We will mark them accordingly.
Okay.
Sorry to interrupt, but please, guys, delegates, mention your country name when you send the chits.
Yes,
in each and every chits, mention your country name, the country to whom you are sending to, and via the EP. Because I'm getting many chits which does not have the country's name to whom they want to send, or from where, or the countries they're representing. So please make sure.
Yes.
Otherwise, your chits will be considered null and void. I won't be forwarding that to the chair.
Point of personal privilege.
Absolutely. Please take into account what Yash said just right now. It's very important. Yes, China. It's okay?
Yeah.
Okay. Okay. Delegates, are there any points on the floor? Seeing none, are there any motions on the floor? Write your name in the chat box. Okay, China. Are there any more motions on the floor? Write it to everyone, not personally to, okay, China, Germany, Syria, South Korea, Philippines. We have 4 countries. Right. Delegate of China, your motion.
Motion to suspend formal debate and move into a moderated caucus on the topic vaccines, their production and mass distribution. For a speaker's time of 1 minute with total speaker's time 20 minutes.
That motion is in order. Delegate of Germany.
Motion to suspend formal debate and move into a moderated caucus on the restimulation of economic activities by trade contracts and international investment to improve job opportunities for a period of, for individual speaker time 1 minute and total speaker time 15 minutes.
Okay. Delegate of Syria.
Delegate of Syria would like to suspend formal debate and move into a moderated caucus for total time 20 minutes and each individual speaker's timing 60 seconds on the topic discussing contextual approaches to COVID-19 and identifying countermeasures and solutions.
Okay. Delegate of South Korea.
The delegate of South Korea would like to move into a moderated caucus of total time 25 minutes with individual time 60 seconds on the motion of infection rate among the healthcare workers in the COVID-19 pandemic.
Okay. Total time and individual speaker's time, can you repeat?
25 minutes total time and individual of 60 seconds.
Okay. Delegate of Philippines.
Same as Syria.
Okay. Delegate of New Zealand.
Delegate of New Zealand would like to suspend the formal debate and get into the moderated caucus on how to develop methods to test maximum of population till vaccine comes into market.
Okay. Total time, individual speaker's time.
Yeah, sorry. Individual time for 90 seconds and total of 20 minutes.
Again, that won't be, I think, that won't be feasible.
Okay, then total time of 25 minutes.
Okay, 25, 90. Is that, will that be divisible? Anyone can do the math quickly, Shorodipto?
No, I mean it should be 24 minutes or 27 minutes.
Yeah, exactly.
For
So,
90 seconds.
Yeah. So it has to be divisible. The total time, like we can't have like 1.5 speakers. We can't have like fraction of a speaker. We need to have like a whole
Let's
number.
make it 24 minutes then.
Okay, 90, 24. Shorodipto, this time it's perfect.
Yes.
Okay. Last is Venezuela. Yes, sir. Your motion.
Yeah, the delegate of Venezuela wishes to abstain from general speakers list and move into a moderated caucus on the topic of commercialization of vaccines as and when they come out.
Okay.
Per speaker time of 60 seconds and total speaker time of 20 minutes.
Okay. So you said abstain. Okay, that's not wrong, but it will be better if you say motion to suspend formal debate.
Absolutely. Sorry, my bad.
Oh, no issues. So going by the order of disruption, so the most disruptive motion has been raised by the delegate of South Korea for 25 minutes, individual speaker's time 60 seconds. South Korea, please repeat the topic of the motion once, the exact wording of the motion.
The topic of the motion is the rate of infected healthcare workers in the COVID-19 pandemic.
Okay, so rate of infected workers in the COVID-19 pandemic.
Healthcare workers.
Rate of infected healthcare workers in the COVID-19 pandemic.
That's
for,
right.
For total time 25 minutes, individual speakers time 60 seconds. Delegates wishing to vote for, please raise your hand, and delegates against, write your name in the chat box. Okay, write your name, country name, and against. We have 9 votes, 10 votes.
Cuba is against.
Okay, Yash, what did you say? Who's against?
Cuba.
Okay, yeah.
And 5 Answer it.
5-4. Rest. That again.
Yeah. Okay, so I think we have total 18 votes right now. Just do something. One of Yash or Sahasra or Shorodipto, just give me one final count of how many delegates are there in the committee. Is it 18 or 19 as of now? We had 18 votes with 13 against. This motion fails. South Korea, you can again raise this motion later on by just.
I think we have 19 delegates.
We have 19 delegates now. 5 EB members and 19 delegates.
Okay.
19.
Okay. Still in this motion, I didn't receive one vote. Okay. Let's hope from the next motion, all of you vote. Right. So South Korea, you can again raise this motion later on by just changing the timing or just tweaking the words. Next, by the order of disruption. So 2490, how many speakers can it accommodate, Shorodipto? Let me.
16, I think. 16 speakers.
Yeah. 16 speakers. So, okay. So next we will be taking the motions that were raised for 20 minutes, individual speakers time 60 seconds. There were three motions for 2060 from China, Syria, and Venezuela. First, voting upon the motion raised by the delegate of China on the development of vaccines. Delegate of China, please repeat the topic.
Yeah, 1 second. The topic is a moderated caucus on the topic of vaccines, their production and mass distribution, along with decommercialization.
Did you add decommercialization in the original one?
No.
Okay. So we can't be having decommercialization because
we can have it on mass production and distribution. Sorry.
Yes, clearly, because decommercialization is another raised by another delegate after you've raised this one. Okay, so delegates wishing to vote for delegate of China's motion for total time of 20 minutes, individual speakers time 60 seconds, raise your hand, and delegates voting against, just write against. So I'm looking forward to 19 votes. Again, so we're still looking forward for 2 more votes. There are 17 votes at this moment.
We actually have 16 votes, 9 for and 7 against.
So three more votes is missing. Okay, now we have one more hand.
Yeah.
So 2 more votes are missing.
Sri Lanka against, I guess. Yes, sent to private.
It is also there in the everyone list. We counted that.
Okay, okay.
Okay, delegates, we can't be wasting more time on this because clearly the procedure states that every one of you need to vote during procedural voting, but I can't see all of you voting. So I hope that you understand the procedure that we are following here, and from the next time onwards, you all of you can sort of give your votes. So right now, with the majority for and the minority against this motion from China passes. We are now in a moderated caucus for 20 minutes, and individual speakers time 60 seconds.
Sorry to interrupt.
Yes.
New Zealand, please write your country name in the chat.
Yes. So
one more point I'd like to mention: the delegate of USA has abstained from voting, so we can remove that. Actually,
USA is in the committee.
She was.
Today today USA was in the committee. I don't think so.
Okay, UK. I'm sorry, it's UK.
Yeah.
UK.
Okay. Then the majority comes down to 18, I guess. Then. Okay, not an issue. So delegates wishing to speak in this moderated caucus, please write your name in the chat box. Moderated caucus on the topic of China. You will be given the option of being the first speaker, so you don't have to write your name. So delegate of China, would you want to be the first speaker or want to reserve your right?
Yes.
Okay, so China is there. Venezuela. Delegates wishing to speak in this moderated caucus, which we'll be discussing on vaccines. South Korea, Italy, Germany, biotech, Philippines, Syria, Oxford, China. Once you have added your name, you can't add unless you've spoken.
Okay. Sorry.
Oxford is there.
I'm sorry to interrupt, but delegate of UK has asked for a point of personal privilege,
Yes.
asking the chair to excuse her voting preference for today because she is facing a lot of network issues. She has mentioned this in the Model WHA WhatsApp group.
Yeah, that's what I said. That's what I was going to say.
Okay. No issues.
She's not present in the committee as well now. I can't see her.
Yeah, she's not in the committee at this moment. Okay, even if she returns back, we can count her as a non-voting candidate in the procedures, because if there are network issues, really.
Yeah, okay, fine.
None of us can help it.
Personal privilege. How many names have been noted for the moderator?
10.
Thank you.
Okay, so
a point of personal privilege.
Yes.
Topic of the moderated caucus be repeated once.
The topic of the moderated caucus is delegate of China. Just repeat the exact wording of the moderated caucus once.
It's on mass production and distribution of vaccines.
So, delegate of China, you have the floor for the next 60 seconds. Shorodipto will raise a hand at 40 seconds.
Thank you for the recognition, Chair. In these trying times, China has put its best foot forward, working tirelessly towards development of a speedy COVID vaccine. One of our health officials has also publicly pledged that an effective coronavirus vaccine will be available by the end of the year. We believe in international cooperation and for the same have also committed to sharing our vaccine with more than a dozen countries already, particularly low-income countries. Wu Guizhen, the chief biosafety expert at China's Center for Disease Control and Prevention in Beijing, has even told our state media last month that two vaccines developed by Shanghai pharmaceutical group Sinopharm will be available in November or December. The vaccines are being tested in countries including UAE, Bahrain, Peru, and Argentina. Though our tireless efforts are Through our tireless efforts, our vaccine makers have developed 4 of the roughly dozen leading candidate vaccines that are in the final stages of testing worldwide. Our President Xi Jinping has already mentioned in the World Health Assembly in May that our COVID
60
vaccine
seconds.
development and vaccine, I'll just wrap up, will be made a public good and will be available as a very low-cost commodity for all other countries. Thank you.
Thank you, Delegate of China. Venezuela, you're next. Delegate of Venezuela.
Yeah, thank you for the recognition. What my primary constructive would be is to recognize how there are certain countries that are going to be affected to a much greater extent than other countries at large, right? We believe that countries with a lesser amount of economics will face a greater amount of dearth when it comes to resources and when it comes to vaccines as well, right? When China talks about making this for the public good, we also find China being the first country to patent coronavirus vaccine rights by this company called CanSino, right? And we find that these are the problems that countries which have lower economies like that of my country of Venezuela will face much harder resources when these vaccines need to come down to our country and percolate to the masses, right? And we believe that without a lot of international cooperation that exists between the countries that have a lot of economic prosperity and countries that do not have stable economies, we believe that there needs to be a good amount of contact and a good amount of communication that ensures the percolation of these vaccines into the people. And thus, we believe that the primary motive here should be, number one, the decommercialization of these
1
vaccines,
minute.
supply chain, I'll just sum up the supply chain management and how these vaccines are going to be brought into the country. Thank you.
Thank you, Delegate of Venezuela. Points noted. Next, we will be having the delegate of South Korea.
South Korea plans to spend $146 million to procure coronavirus vaccine, initially aimed to secure 60% of the population, and additionally, we plan on $70 million for 20 million doses from COVAX, which is a WHO partnering company. However, we believe that there has been a lot of discrepancies in the testing of the virus vaccine, which is especially Russia in the phase 2 has only tested 76 individuals without proper data sharing. We cannot have this sort of a discrepancy in data when it comes to testing of a vaccine. Hence, we need to monitor the data sharing. We need more people. We need more data from all the countries. China does not reveal its data at all. We need more data and such that we can make sure that this vaccine is going to help our countries as a whole.
Okay. Thank you, Delegate of South Korea. Points noted. Next, moving forward, Delegate of Italy.
Yes, the delegate of Italy. Regarding the vaccine, Italy is also producing a vaccine from the Lazzaro Spallanzani Institute of Infectious Disease in Italy, but it is still in the phase 1 clinical trials. So it is very far from appearing in 2021. So Italy believes that Italy also has to rely on vaccine supply from other countries. Italy, being a stable economy, will be able to purchase maximum of its requirements. But countries with unstable economy and economy failing or depleting, for those countries, Italy wants the WHO to step up and set up a fund like a vaccine fund, so that other countries could get help from that. And yes.
1 minute, yeah.
Thank you, Delegate of Italy. Delegate of Russia, your point is correct. Just send it as a point of order. if you send it as a point of parliamentary
Thank you.
inquiry, it's a fact. We can't be like clarifying facts as in point of parliamentary inquiry. You have pointed out a factual discrepancy. Just send it as a point of order, and then it will be marked.
Yes, fine.
Yes.
Thank you.
Okay. Next up, we have the delegate of Germany.
Yeah, thank you for this opportunity. Germany currently has no plans to make sure that there is in-house production of vaccines, but we have taken up clinical trials in association with Pfizer and BioNTech, and there has been an investment of about 375 million into this company, and by late October we expect better results. But in this slide, Germany would like to invite imports of vaccines from Russia and China for further integration into our society. Owing to the strong healthcare system, smooth distribution of these vaccines can be ensured. But in other countries where there is a high population and high infectivity rates, we think that in-house production of vaccines and better distribution lines need to be established so that availability at low costs can be ensured in these countries. But for Germany, it should not be a problem currently. Thank you.
Thank you. Delegate of Germany.
I'd like to invite questions.
No, delegate. In a moderated caucus, we can't.
Invite. Yeah, sorry. Yeah, I realized.
Delegate of Bharat Biotech, you're next.
Since I am a representative of a pharmaceutical company, I would like to point out that we are developing 3 vaccines, and out of which one vaccine, which we have been developing with a partnership with the University of Wisconsin and Madison. We have already started the production for over 300 million doses of the vaccine. Even though we are in phase 3, we are still trying to make as many as possible for global distribution. Also, I second the views of the delegate of Italy that yes, there should be some aid provided by WHO for the global distribution and production, but there are many informal NGOs that are also providing aids for this purpose. And as a country right now, health is more important than wealth. So without seeing the profit, we Bharat Biotech, and I think most of the pharmaceutical companies are not looking for profit, but we are looking forward to provide the vaccine to all the countries that are in need of it. Thank you.
1 minute, yeah.
Yeah. When we're delegates, just a clarification from the EB, when we're talking about NGOs and everything, just keep in mind that the only NGO that the United Nations actually have any sort of, that the United Nations can sort of have supervisory mandate over is Red Cross. Apart from that, all the other NGOs doesn't come under the sort of the activities and mechanisms of the United Nations. It's only the Red Cross and nothing else. However, if a particular country or a particular pharmaceutical company or university wants to take their own initiative to partner with other NGOs, it's completely their own right. It's completely their own discretion. They can do that. But as United Nations, we can only work with Red Cross.
Okay, thank you.
Right. So next up, we are having the delegate of Philippines.
Thank you for the recognition. The world is in the race to find a safe and effective vaccine. The Philippines joins our partners in the ASEAN and the non-aligned movement in raising our collective voice. That is, the COVID vaccine must be considered a global public good and be equally distributed. The delegation of Philippines lately does not have any resources to develop its own vaccine, but it has invested and agreed upon by the Russia and will be starting clinical trials from October to March 2021 for the Sputnik 5. And the Department of Science and Tech has also included Sinovac from China among the prospective collaborators in the country. It has also agreed with the WHO Solidarity Trial approved by the Single Joint Research Ethics Board on April 17 this year in response to COVID. The delegation of Philippines would also like to suggest that all the developing countries that do not have any resources, just wrapping up, resources to come together and pool in the resources so that we can be self-sufficient. Thank you.
Ujan,
yes, sir.
Before you proceed on to the next delegate, China had a point of order on the Venezuelan delegate's speech That point is not in order, China, if you're listening, because China feels that when Venezuela says it's not working towards the public good is an incorrect statement. It's a conception, right? It's an interpretation which Venezuela has. So it might feel that you're not working towards public good. So don't send these types of points of order, right? It has to be factual, right? Is that under? Yeah.
I gave reasons on why that is not correct. Like
No,
because
sir, because I'll tell you why. Because I can say I have spent millions of dollars on something, and then you might still say that it is not doing any public good, because that's what you feel, right? So that is not a reason which you can. If he would have said that it has not invested any money, it has not spent any sort of economical anything it has done, like any sort of relief or something, then you could have raised that point of order. But he just said that you're not working towards public good. He might feel that because you have concentration camps for illegal Muslims in your country. He might feel a lot of reasons, right? So I think that's fine. Okay, that point is not in order. Otherwise, your other points are good. That those are accepted and marked. Okay. Thank you.
Okay, so right. Next, moving on, the delegate of Syria, you have the floor.
Am I audible?
Yes, you are.
So delegates at this point thinking that a vaccine would be available at such an early time, it's not right. We've had vaccines of AstraZeneca and Oxford University show up in the phase 3 clinical trials of their vaccine. It showed up neurological symptoms in the subjects. One subject developed transverse myelitis. One subject developed symptoms of multiple sclerosis. So it's not right. Vaccine development would take time. What we need to do as the World Health Assembly right now is to identify companies which have a very good supply chain and which are able to donate a lot of doses for low and middle income countries. For example, Biological E, which is a company based in India, they have promised that they can develop 1.5 billion doses, and there are a lot of companies like Gavi Vaccine Alliance, which is based in Geneva, and it has said that it can raise $2 million for lower and middle income countries to supply them with adequate doses. So I urge the committee to identify these type of companies that would be able to provide. I'm just summing up. That would be able to provide doses to these countries, and then we can develop a holistic approach.
Thank you, delegate of Syria. Moving forward, next we have your points noted. Moving forward, next you have delegate of Oxford.
Thank you, Chair, for the recognition. The Oxford, basically we have done a collaboration with the Institute of Jenners for our Covaxin. So even the AstraZeneca, it's going to be it is a company that's going to manufacture the vaccine. But since some of the news that has come that the AstraZeneca, there has some the negative impact, side effects. But I would like to emphasize that we have right, it's been you need to see that whether it is really a fault from the vaccine side or from the patient side. So yeah, I would say that it's still under process to judge whether it's due to vaccine or not. And secondly, I would like to say that we have a pact with the British government that we'll be ensuring our vaccine as soon as possible in the UK market. First, obviously, we'll give the priority to the eco population, and as part of our agreement with the AstraZeneca, we're ensuring that those countries who are most vulnerable to the worst effect of this global pandemic have early access to the vaccine.
Okay. So Iran and Kenya, are you adding names for the moderated caucus?
Yes.
Okay, we will be asking for names, and then you will add your name. Then you can write your name in the chat box. So next we have the delegate of New Zealand. Delegate of New Zealand.
Thank you for the opportunity. I would like to say that New Zealand has always been widely praised for handling coronavirus crisis. So because it has always taken steps at the earliest, and here also it has stepped forward in vaccine development. New Zealand has a team of local and international experts with proven capability in vaccine research and development to support COVID-19 vaccine research in New Zealand. Auckland biotechnology company BioCell, it has upgraded its existing facilities, which will boost our local manufacturing capacity and will also help support global vaccine production. It has also undergone international research collaboration with those by Coalition for Epidemic Preparedness Innovations, that is CEPI. It has collaborated with CEPI. And it has also taken official developmental assistance for Vaccine Alliance Gavi, which is responsible to distribute vaccine to developing countries. So New Zealand has definitely taken steps in this field as well. And on 27th of August, the government announced that additional funding has been set aside within the COVID-19 response and recovery fund. So I'll wrap up the thing very fast. It has also taken participation in global initiative like COVAX facility. And we have also invested early in vaccine development process and tools, and we are using tools like advancing purchasing arrangements to enter into early agreements with vaccine developers. Thank you. That's all for New Zealand.
Thank you, Delegate of New Zealand. Moving forward, we will be taking more speakers for this moderated caucus. Now, firstly, I would request the delegates who have not spoken to add their names first. So, Iran.
Do we have to add our names again?
No, delegate. Iran and Kenya, you have written already, so we have recognized you. So, Russia. So, Venezuela, you have spoken. So, we are first taking the names of delegates who have not spoken in this moderate caucus. Russia.
And one point here, I can't enable my video. It is showing that the host is not allowing you to enable the video.
Okay, so the host allow the delegate of Kenya to enable the video.
Okay, it's done. Thank you.
Okay, right. So the delegates who have not spoken in this moderated caucus, this is a very pertinent moderated caucus, so we request all the delegates to speak. Delegate of Spain, you have not spoken. Would you like to add your name?
Point of personal privilege,
Delegate,
Russia.
Yes.
Could you please just clarify the order right now for the next speakers of the moderated caucus?
So next we have added 3 more names: Iran, Kenya, Russia.
Okay, thank you.
So delegates who have not yet spoken in this moderated caucus, delegate of Spain, would you like to add your name? Delegate of Philippines, would you like to speak in this moderated, or Philippines has spoken, sorry. Delegate of Ethiopia, would you like to speak in this moderated caucus?
No.
Okay, delegate, not an issue. Delegate of Switzerland, because this topic is very pertinent and all of you have like something or the other to say in this topic. It's a very relevant topic of vaccines. You can approach this topic from various ways. Okay, so Cuba has added her name. Delegate of Switzerland, would you like to add your name to this moderated caucus? You have not spoken in this moderated caucus yet.
No.
Okay, delegate, not an issue. Delegate of the United Kingdom, would you like to speak now in this moderated caucus?
I actually have a point of personal privilege. I do not know the topic of moderated caucuses.
Oh, so the topic of the moderated caucus, yes, it's the mass production and the distribution of vaccines. So United Kingdom, do you have anything to say on vaccines of coronavirus? You can add your name in this moderate caucus. Okay, so I think UK doesn't want to speak right now. No issues. So, all right.
Sorry, Chair, I just got disconnected and reconnected. I would not like to talk on this. Thank you.
Okay, not an issue. There's no obligation, just that this topic was one of the most generalized topics and one of the easiest. Hence, I thought all of you have something to say in this. You can already you already know a lot on vaccines and you can see a lot of things without any specific research. So that's why I encouraged all of you to speak here. Right. So first we'll be taking delegate of Iran. Delegate of Iran, you have the floor for the next 60 seconds.
Point of personal privilege.
Yes, delegate.
More names be added to the list?
Yes, 6 more names.
Can they be added right now?
No, first we have to let the delegates who haven't spoken speak, and then we'll be taking names for the second round.
Thank you,
Okay.
Chair.
Okay, delegate of Iran.
Okay, the delegate of Iran would like to say that Iran has joined COVAX, a global initiative aimed at working with vaccine manufacturers to provide countries equitable access to safe and effective vaccines once they are licensed and approved. Iran has also said that it will buy 20 million doses of a vaccine made by an unnamed Indian company run by an Iran born man. Iran understands that this virus cannot be underestimated, and even if when we have an access to a vaccine, Iran believes that everyone needs to maintain the lifestyle of social distancing, using masks and washing hands regularly. Thank you.
Okay, thank you, delegate of Iran. Just for the better clarification of the committee, you don't have to answer it right now. Next time in your speech, if you can just find out the name of the company that you have mentioned as unnamed, if it's available in the internet, if you can just find out and mention it, it will be like better for the committee. However, it's not
Yes,
obligatory.
I searched for that company, but I couldn't find any reliable sources.
Okay, okay, delegate, not an issue. If you find anything in the future, just send it via chat.
Sure.
Okay. Next, delegate of Kenya.
The delegate of Kenya would like to say that the vaccine trials will begin in the country in a few weeks on the healthcare workers using the Shadox 1 NCOV, which was developed by the University of Oxford. But the delegate would also like to add that the vaccines are a long way, are about 8 months, 6 to 8 months, or perhaps 1 year away from being available in the market. So it would like the pharmaceutical companies as well as those who manufacture healthcare equipments to please help countries like Ethiopia, Kenya, and other African countries with aid in medicines like the antiviral drugs, as well as in the supply of ventilators and other medical equipments. And I would also like the World Health Assembly to look into to help the countries like Ethiopia, Kenya, Venezuela, and others. Thank you.
Thank you, delegate of Kenya. Your points are noted. I think this is where we are sort of channeling the discussion in the right way. So Kenya, you mentioned that how help should be provided to various countries while the vaccine is still in process. Now, as diplomats, as well as, so you are not just doctors, but doctors and diplomats, you need to find out policies, you need to find out options and the role of the WHO in finding solutions for this problem, the distribution, the channelization of funds, the mechanisms through which they will be distributed. You need to hit hard on the policy options that need to be adopted. You're asking for help, that is great, but as diplomats, you have more responsibility than just to ask for help. You have the power to form policies where you are not just asking for help, you are actually forming policies to get that help yourself. So that's what we encourage you all to do. Look into policy options of how these things will be dealt with while the vaccine is still in process, the distribution of medical supplies and essential equipments.
Okay, sir.
Yeah, so this goes to the entire committee to ponder more upon the policy options as WHO diplomats. Right, next, the delegate of Russia.
Thank you, Chairperson. Am I audible?
Yes, you are.
Okay. So first of all, the delegate of Russia would like to clarify something. Delegate of Venezuela mentioned that China may be the first to declare the vaccine. Well, sorry to inform you, but on August 11th, Russia has already declared itself to be the first country to make a vaccine. Second of all, North Korea mentioned how we have not provided any statistics or any data. Lancet, there has been a publication in the Lancet Medical Journal regarding the clinical trials with Russia. From Reuters, there is that you can check out the August publication that there is more than 1 billion people are supposed to receive the vaccine from Russia. The Sputnik V vaccine is a vaccine which is not what is being said is that it's not been clinically tested or anything. But what you need to realize is that this is a vaccine which has been developed and processed from an already tested vaccine for the Ebola virus. Therefore, this is a clinically test. This is a additional additional vaccine which has been made through clinical testing. And last thing, I would like to conclude by saying that Russia is the first potential vaccine, and it has already decided to have proper mass testing. Thank you.
Okay, thank you, Delegate of Russia. Which country said that you don't release data? You said North Korea.
She mentioned that there was no South Korea. Sorry, South Korea. That is a slip. Sorry.
It's okay, Delegate. It's okay.
I have a point of personal privilege.
Yes.
Are we marked on the replies also, the chat that we are replying to? Are we marked on that as well?
Yes, absolutely.
Point of
If
order.
you're sending it via the,
yeah, I'm sending.
Okay, yeah, Delegate, point of order. Yes, we have a point of order.
Yes, I did not mention that Russia is not releasing data. I said that Russia has only tested 76 individuals in the phase 2 coronavirus vaccine clinical trial, which is very less because typically the phase 2 must comprise of 100 to 1,000 people.
That point is in order because we have the verbatim, and the delegate, that is true, Delegate of Russia. Delegate of South Korea didn't mention.
Point of order.
Okay, yeah, we're coming to you, Venezuela. So Delegate of South Korea didn't mention as a statement that you don't release data. You, in your speech, made a statement that she stated this, but that is wrong. She has not stated this. So that point of South Korea will be in order. Yes, Delegate of Venezuela, your point of order.
Yeah, so Russia said that Venezuela said that China was the first country to release vaccines. We did not say that. We said that China was the first country to patent a vaccine.
Okay, Delegate, since the Delegate of Russia mentioned it as a statement, so that point will also be in order. So we have 2 points of orders. Russia, you don't have to clarify anything. Just the fact is that when you're making statements on other countries, make sure you don't do it as like a final statement. Don't state these things. Say it's your opinion, or we call it diplomatic sugarcoating. Use words which will sugarcoat it in such a way that it won't sound like a statement. If you're giving a statement, countries like South Korea, Venezuela, they are raising points of order on your statement, which is correct because you made these statements, right? If you can sugarcoat it diplomatically, these points of order wouldn't have been valid. But since you stated this, these points of orders are valid. Right. So just give me a second. Okay, and Venezuela raised one.
It's a point of parliamentary inquiry.
Yes, Delegate of Syria.
Sir, in these situations that just happened, wouldn't it be better to raise right of replies rather than point of orders?
Right to reply, as in?
Because in this particular scenario, that Russia stated that this was the case, wouldn't it be better for countries to raise right to replies rather than point of orders on this?
But Russia clearly stated that these two delegates have stated these things in the committee. So it's based on their statement. It is not infringing the sovereignty or integrity, I guess.
Okay.
So right to reply is very specific for sovereignty and integrity of a particular country, as I've mentioned.
Okay, thank you.
Okay. Right. So next, moving forward.
I have a point of parliamentary inquiry.
Yes, Delegate of Germany.
Can I add my name to the list of for the moderated caucus now, or am
after I? After Cuba, we'll be asking for more names, and then you can write your names.
Okay.
So the delegates who have already written their names, Venezuela, China, you have to write it again. When
excuse me, I have a point of parliamentary inquiry.
Yes, Sri Lanka.
I have given my name for moderate caucus. Is it added?
You have to write it again when we'll be asking for it again for the second round. Right now, we're only taking those who have not spoken yet. Delegate of Cuba.
Thank you, Chair.
Delegate of Cuba, sorry to hold you up, ma'am. Please.
Thank you, Chair. So Cuba has kicked off clinical trials this week of a potential coronavirus vaccine called SAMSACON 1, which is developed by its state-run Finlay Institute. Its results are due in February. And also our biopharmaceutical industry, which is the BioCuba. Cuba Pharma has also started developing capacity in order to increase the production of the doses of the vaccine. And also because of now, especially with the increased US sanctions against Cuba, we would like to reiterate to the international community that the Republic of Cuba is ready to collaborate and also provide vaccines to interested countries in order to ensure health for all. And also the results of these clinical trials so far have been very promising, and we would look forward to collaborating with everyone. Thank you.
Okay. Thank you, Delegate of Cuba. Right. So your points are noted. Moving forward, we will be taking 6 more speakers for this moderate caucus. Delegate who wishes to add their name, please write it in the chat box. Syria, China, Venezuela, Sri Lanka, Germany. One more we can take.
Point of parliamentary inquiry, Chairperson.
Yes.
China has asked a point of order to Philippines, and I've replied it privately. Should I reply it to the EB also?
Yes, then we can mark
okay. Okay, I forgot to reply, so I'm replying now. So please just make a note of it. I've already.
Point of order. China did not send any point of order. They sent a point of.
Sorry, point of information. I'm really sorry.
After Germany, we have Oxford.
Okay, okay. China, that point is in order. Thank you. Okay.
After Germany, we have Oxford.
Oxford, yeah, sure. So let me just give me a second. I'll add these names. So Syria, then CCP, China, then Venezuela, Sri Lanka, Deutschland, Oxford. Bharat Biotech, I'm sorry, we have exhausted the list, so your name can't be added. We already have 20 speakers now. So next up, Delegate of Syria, you have the floor for 60 seconds.
Thank you, sir. So, delegates, what we can do is we can consider setting up an integrated manufacturing, distribution, and administration chain. And so what happens is that the vaccine manufacturing, distribution, administration chain would represent a complex system with multiple parts. And its job would be to maximize distribution speeds, maintain the stability of the vaccine product, maximize vaccination coverage, and minimizing costs. Mathematical optimization algorithms could be instrumental in designing these systems. By developing such methods, the entire system might be operated at its maximum potential. Now, what else we can do is we can identify 3 groups of people that are in dire need of vaccinations in various countries. The first group would be the priority group, which would require vaccinations at the urgent because they're high risk, because they're at a high risk of infection. Patients with comorbidities, for example. The second would be vaccinations in these areas which can exist as clusters or which have a huge chance of increasing infection rates. The third group would be the general population. So by doing this, we can maximize the limited availability of our vaccine doses.
Thank you, Delegate of Syria. Points noted. Next, we have Delegate of China.
Thank you for the recognition, Chair. A very important discussion when it comes to vaccines, which hasn't been mentioned, but the Chinese delegate would like to stress upon, is the need for mass distribution. This distribution of the vaccines also needs to be carried out at an ever-increasing rate and to all parts of the globe which cannot even afford the vaccine. The companies which have large capacities to produce these vaccines need to come together at this time and aim to provide as many citizens of the world with a possible safe and efficacious vaccine. The National Health Commission also said of China that China's annual production capacity of vaccine currently sits at more than 610 million doses and is forecast to reach 1 billion doses by the end of the year. This makes us pivotal along with countries such as India in making sure that affordable, high quality vaccines are provided to all countries of the world. China would like to end with urging all nations to take note of this important topic of discussion and come up with a specific response plan to be able to achieve this mass distribution of vaccine in the future.
Minute.
Thank you.
Okay. Thank you, Delegate of China. Next, Delegate of Venezuela.
Point of parliamentary inquiry.
Yes,
At the starting of meeting, what the chair said about the messaging the chits about to other country after 12:30. Can we message chits to EB today as well, like yesterday?
Yes,
Or
yes.
it
You
is
can message the chits to EB till 9:30 at night, 9:30 p.m. So yeah, but not to other delegates.
It's only directed to the EB, not
Yes.
for other country.
okay.
Because yesterday it was sort of a logistical nightmare for Yash, who had to also organize other events and constantly send the chits to all the delegates at like every time he was receiving one. So just to make the entire procedure smooth for the entire committee, we will be only having chits for the EB after 12:30.
Point of parliamentary inquiry, sir.
Yes.
We can reply to the questions to the EB after the meeting, right?
If the question is sent by another delegate, obviously, I mean,
Yeah.
the EB doesn't ask question by a
No.
chit. So if this question is sent sent by another delegate and you have to reply that, so what you can do is that you can keep your replies prepared, and on the next day when the committee begins, you can send it on the chat.
Okay, so we can only send the substantial chit after the meeting.
Yes.
Okay.
A point of personal privilege.
Yes, delegate.
Actually, Yash, you've resent me this chit you sent earlier, and I've replied.
You can just write it in the chat box. You need to mention it.
Okay. Thank you so much.
Okay. Next, delegate of Sri Lanka, delegate of Venezuela is the next speaker. Delegate of Venezuela.
Point of parliamentary inquiry.
Yes, delegate. Yes.
I have resent the chat. I've already told the EB that I will be resending it.
Okay.
Yeah. Okay.
Sorry, delegate of Venezuela, to keep you holding, please.
Yeah, thank you for the recognition. The first thing that I would like to stress on is what Venezuela is doing about the coronavirus vaccine, right? We've been partnering with Russia and we've been receiving shipments of Sputnik 5, the vaccine that Russia has produced for volunteer treatments that's been done on the people of Venezuela, right? And we need to stress upon an important fact here, how international relations play such an important role in the transfer of vaccines and how important countries control a lot of vaccine inflow into the countries, right? So we believe there is stigma that is associated with a number of countries. For example, of Venezuela, the conflict that is there between the Venezuela and the West and the Americas, right? The conflict that's there between Venezuela and America plays an important role in how Venezuela might be treated as an outcast and might not be given the equal privileges as to when a vaccine comes out from an USA, from the Western countries as to speak of, right? And we believe that this kind of a stigma, this kind of an outcast, and this kind of a oppression of a lot of countries may occur in contrast to like countries like Syria and countries like Ethiopia and my country to speak of, when there might be an inherent bias.
1 minute.
That's why those vaccines might not be coming into our countries as readily as they might be in other countries. Thank you.
Okay, Venezuela, points are noted. Just to make one thing clear, when you're referring to certain category of countries, using terms like West, East, these terms are very, they're very, I won't say vague, but they are very wide terms. When you say countries released by vaccine released by countries from the West, Venezuela also lies in the Western Hemisphere. So when you're essentially referring to countries in the West, you also fall in that category of countries. So what I would suggest you is that rather than using wider terms for countries, if you can mention the group of countries, if you can mention the specific countries that you're naming, then it will have a lot more clarity and it will provide much better direction. However, your points are noted for this speech as well. Just make sure to use these terms from the next time onwards.
Yeah, thank you.
Right. Generally, the terms that are used in MUNs are words like OECD countries or G7 countries or G20 countries or Annex 1 countries. These are the words that are used in MUNs or in the UN to refer to the category of countries. But these are very technical things. I won't be going into them right now. It will waste the committee time. So just mention the name of the countries that you're referring to. Next, delegate of Sri Lanka.
Thank you, Chair. So as the big nations are going on with their trials, and it may take almost a year to complete with the trials and all, but the main part is the distribution and the mass production of the vaccine. So here the World Health Assembly should take the certain steps like demanding full vetting as would be experienced by any vaccine, then central to the development of new norms and standards in the move towards more open science, emphasizing things like biobanking and ensuring samples and are available for research who should not compromise with the safety of the research and development products. So the World Health Assembly should take these resolutions in their assembly so that the distribution and mass production is without any hazards.
Okay. Thank you, Delegate of Sri Lanka. Again, the same mistake. You said big countries. Big countries as in big in what respect? Like
big economy.
Big. Okay. Okay. So again, you have to mention more specifically about these things. Big, I mean, Brazil is also big country. Brazil is a massive country. So
yeah.
I'm not sure how much successfully Brazil can develop a vaccine at this moment.
Big in the sense economy.
Yes.
Yeah.
Okay. So just for more clarity, try to mention these terms economically, economically better off countries and these things.
Yeah. Okay.
Okay. Right. Next up, Delegate of Germany.
Yes, Parag. Thank you for this opportunity to speak. As my fellow delegates and the delegate of Syria mentioned, it is important to establish a secure supply chain by strengthening the healthcare framework to make sure the vaccine is available to the people and the public when it does come into the market. Also, I think commercialization of COVID vaccine to reduce the cost and increase accessibility should be looked into, and companies and the country should urge the companies they house to go forward on that path. Also, it is essential to encourage the companies to give up patent rights so that other countries may also develop upon the same vaccine to make it more efficient. Also, countries should look into their policy of mandating and non-mandating vaccines so that when the vaccine does come into effect, we can achieve herd immunity at the earliest. That is when 51 to about 65% of the population is vaccinated. As my delegate of Syria mentioned, we should also suggest that division up of population, but instead I suggest the division country-wise into where there is presence of active infection, moderate or controlled infection. I'd like to conclude here. Thank you.
Thank you, Delegate of Germany. Your points are noted.
A point of personal inquiry.
Yes, point of personal privilege.
A privilege. Sorry.
Yes,
I would like Germany to means she told about the herd immunity. I could not get that point or could not listen to that part properly. So can she repeat once?
Delegate of Germany, just repeat the point regarding the herd immunity.
Herd immunity is a part where when about 51 to 60% of the population is vaccinated, the rest of the population also seems to develop a sort of immunity to the disease. So it's like the entire population is vaccinated. So it's like, so if you vaccinate a large number of people, it would be equal to vaccinating the entirety of the population because they develop immunity. So
the herd immunity you are talking about is with
Delegate of Kenya, no crosstalk.
Okay, sorry.
Right. So firstly, is it clear the point that she mentioned? Is it clear to you?
No, I wanted to know that the herd immunity that she was talking about, whether it was with respect to natural infection or with respect to vaccines.
Vaccines, like we aim to do it by vaccines because natural infection would lead to high amount of mortality.
Okay, got it.
Okay,
thank you.
So point of personal privilege can only be asked to not as a question on the speech, but just if you can't hear a particular line or a certain section of the speech, the delegate can repeat that. But right now, what we did here is a sort of point of information, right? So this thing we can't allow, this clarification part. We can only ask if somebody is not audible. Understood, delegate? Okay. So next we have last speaker, delegate of Oxford University.
I have a point of parliamentary inquiry. May I?
Yes, delegate.
Like the reply delegate of Germany gave to probably delegate of Kenya, can I raise a point of order on that? Like in a chat or over here, anything?
Point of order, yes. What point of order?
Like she said that natural infection would cause a lot of mortality, natural infection. But like in cases of Maharashtra, India, we heard that like there was colonies, there were areas where herd immunity was reached. Just because people were infected of COVID-19 and naturally they achieved herd immunity in few areas there. So it is not always that it is going to result in mortality. Natural infection is actually helping in raising herd immunity. In few parts, it has been already observed.
May I counter?
Okay, delegate of Germany, do you have a clarification on this? Germany?
Yes, I understand. I understand natural infection can lead to immunity, but that is an unpredictable factor that we're not ready to take the risk for. It should be an infection that would be difficult to contain. So we as a government believe that we'd like to wait for the vaccine in order before we resort to more desperate measures.
Right.
May I answer?
Right. Okay. So first, let me make something clear. Point of order is a very specific thing. The delegate mentioned this. This is factually wrong. This is the right thing. Right. Now, delegate of New Zealand, I totally understand what you mentioned right now, that there have been cases, there have been results where we have seen that what the delegate of Germany said doesn't totally always result in that. Herd immunity has been reached through infection as well. However, this is one of the inferences that we can get. And delegate of Germany, what she said was one of the interpretations, one of the results that she referred to. Now, what I mean here is that you can send this thing, you can write the same thing via substantive check. We can mark it as that, but we can't entertain it as a point of order, because there are two different inferences of the same thing that both are possible. One was raised by Germany, one is raised by you. So this is not exactly a conflicting fact that one is conflicting the others. So you've said that we have seen in Maharashtra that this case has also been seen, which means that this has also been seen. That means that Germany's case is also true. Your case is also true.
Point of parliamentary inquiry.
Yes.
So for example, in this previous scenario, wouldn't the point not be in order because you can't raise a point of order to a point?
No, that we haven't taken the point of order into question.
Oh, okay.
I was just clarifying myself regarding what exactly this conversation is about, because the point of order was on a particular instance that has been seen in India, and the point that was raised by Germany was another point. So I was trying to make a link regarding how it can be treated.
I'm so sorry for the disruption.
So this point of order can't be taken. However, delegate of New Zealand, we can still use. You can still get marks from this if you can write it as a substantive check. You can write your own sort of inference.
I have one more point. Can I raise it?
What point?
It's a reply to what delegate of Germany said.
No, delegate. I mean, we can't have a reply to a point of order and a reply to a point of order. So firstly, we won't be entertaining this point of order, but obviously
I can send it via a substantial chip, right?
Yes. Also, you can raise this point in your own speech.
Okay, thank you so much.
Okay. So, delegate of Oxford University, please. Sorry to keep you waiting.
Thank you, Chair, for the recognition. The University of Oxford is at the forefront of global efforts to understand the COVID-19 and protect our communities both in the UK and throughout the world. As more than a half dozen of pharma companies race to develop vaccines to fight COVID-19, I would like to enhance and draw your attention to the fact that AstraZeneca has stood out for its pledge that it won't try to profit off its shot until after the pandemic ends. As our company, AstraZeneca believes that to support broad and equitable access around the world. So what do you mean to say that the countries who are worst affected and worst hit by this pandemic, we want to emphasize that we will be helping and prioritizing those companies. So far, this research has received funding from many different sources, including government, trust, foundation. Yet there is much still to do. Today, we appeal to all all the developed countries to please support and fund the companies, especially Oxford, who are in the first run or foremost run for the vaccine. and we really believe that your support today will help accelerate our time critical research, and same will appeal to all other companies that please put humanity before profit. Thank you.
Thank you, Delegate of Oxford. So we have exhausted the total time for this speech. Total time for this motion. Now, at this moment, are there any motions on the floor? Please write your name in the chat box. After a moderated caucus ends, we can only have one kind of motion. Yes, Delegate of South Korea, followed by Russia, followed by Oxford. Delegate of South Korea, your motion.
Delegate of South Korea would like to move to general speaker list by ending moderated caucus.
Okay, Delegate. A general speakers list, we will be moving automatically, so we don't need a motion for this. Right now, we can only have a motion for extension. Right. So we won't be taking that motion. So Delegate of Russia.
Motion to extend the moderated caucus for another 8 minutes.
Okay, that motion is in order. Delegate motion from the Delegate of Oxford.
The Delegate of Oxford would like to extend the motion for another 5 minutes. For another 5 minutes.
Okay, per speaker's time remains the same, so you don't need to mention that. Delegate of Sri Lanka.
No, it was same as South Korea.
Okay.
Okay, it would
Right. So firstly, based on the disruption, order of disruption, firstly we'll be voting upon Russia's motion. Delegates wishing to extend the moderated caucus for another 8 minutes, raise your hands. Delegates against, write your name and against in the chat box.
Two participants have raised their hands.
Yes.
5, 6, 7 are against. 3 are for and 7 are against. 8. Okay, Cuba is also against the motion.
So how many votes do we have total? I think 14, 15 votes.
Yeah, we have 4 for.
And I think 11 against.
Yeah, so 15 votes.
Yep.
Still, I don't think we have everyone voting.
It's 13 against.
13 against and 4 for.
14 against.
Okay, cool. So we have exactly 19 votes. So this motion fails. Now we'll be taking the motion raised by the delegate of Oxford University for the extension of this moderated caucus for another 5 minutes. Delegates, first put down your hands. Okay, I'll lower them. Okay. Delegates wishing to vote for this motion, raise your hands. Delegates against, please write in the chat box. Okay.
7 against.
7 against. 6 for.
6 for and
8
7
against. 6 for.
Okay, 8 for.
8, 9. Okay.
Okay, 9 against and 8 for. Okay, 9 for, 9 against.
9 for, 9 against. Okay. So we are in a stalemate. Delegates, well, I guess we have to take voting for this one more time. Okay, delegates, firstly, please lower your hands, everyone. Yeah. Now, again, please, those who are for, raise your hands, and those who are against, write it in the chat box. Okay. 4 for, 8 against.
I think we have 10
10
against.
against. We have 10 against.
10 against and 4 for.
Majority, I guess.
Majority is against, but not all the votes have yet come in. So I can't actually proceed without getting all the votes. That's a normal procedure of UNA USA. So these delegates who haven't voted, okay, so 5
Give
are
5 for.
15.
7 for.
Okay.
1 vote is.
One more vote is remaining.
Okay, 8 for.
Okay, okay. So that this motion fails as well. So now we'll be reverting back to the general speakers list. In the, wait a second. So in the GSL, next we had New Zealand, Philippines, Venezuela, Germany, Italy. The GSL stands as this right now. So next we have the delegate of New Zealand. Ma'am, you have the floor for the next 90 seconds.
Thank you for the opportunity once again. New Zealand, as we know, it is one of the 9 countries that was declared COVID-19 early, at the very early period of time, though there was some recurrence after some time, but globally it was to a very little extent. I would like to emphasize that our government has always been very early at all its measures taken. When the very first case was reported on 28th of February 2020, immediately New Zealand was the first country to ban all the flights landing from China, and also imposed 14 days isolation arrangements for all the overseas landers. So these are the points I would like to raise, and I'm telling this again and again because I'm emphasizing on measures taken by New Zealand, because I think New Zealand has a much more organized way to tackle this COVID-19 crisis in comparison to much more developed countries present here in WHA. And our country, though we have very less cases, or like only 2 cases in last 2 weeks, still we know it has been eliminated to an extent. Our Prime Minister is very cautious. She says that elimination is not a point in time, it is a sustained effort. Country can still see cases, certainly see cases. So she is still very cautious, and she is raising she's taking measures again and again. She is going for rapid testing. She is going to
90 seconds.
She is trying to cover maximum population for rapid testing. And as I said before, the people who are getting infected actually can raise herd immunity, and so she's making rapid testing, and she's isolating people, and then this cases gets under control. And this is what I would like to say on behalf of New Zealand. Thank you.
Okay, okay. Thank you, Delegate of New Zealand. Your points are noted. Try to stick within the time limit as much as you can. When Shorodipta says 90 seconds, try to wrap up your last point then.
Okay.
Okay, points noted. Next, yes, China.
The New Zealand delegate said that the Prime Minister is trying to raise herd immunity.
Okay, what point is this again?
The New Zealand delegate said that they have
which point? Which point?
Which
point of order or parliamentary inquiry?
Order.
Okay.
Point of order. The New Zealand delegate said that the president was trying to obtain herd immunity. Herd immunity is only obtained if the entire population gets COVID, not if the entire population never is exposed to the virus, which is an incorrect fact. They are trying to minimize the number of cases and not expose any citizens to the virus.
Okay, wait. Delegate of New Zealand, before you can move, Delegate of China, this I can't be taking this point of order because, firstly, New Zealand has a prime minister, not a president. New Zealand has a prime minister, and New Zealand doesn't have a constitutional head like a president or a king or a queen. So in that case, it was the prime minister. And so this point of order you raised, I'm sorry, but this won't be in order. And the delegate of New Zealand never said the president is trying to raise herd immunity. So see, it has already been almost 2 days into this committee, and now you all try to understand. You all should start to understand these little, diplomatic errors and diplomatic nitty-gritties that needs to be taken into account in the committee. These are very, very important, very vital as diplomats. In casual conversations, obviously, we would have understood that you're trying to mean the prime minister, but in diplomatic conversations, if you say president, we will take it as president. Right? Okay. So that point
can the delegate repeat the line she said regarding herd immunity?
Okay.
Yes,
She can repeat,
sure.
but no questions or discussions will be raised on that right now. Okay. Because it's a point of personal privilege. Yes, delegate.
My point was that as New Zealand has been widely praised for handling COVID-19 crisis, it's we have a very little population and our population was not that much infected. We have very less number of cases. This is a message. The Prime Minister is trying to give this message that we can, she's following the criteria. She's following the methods of rapid testing. She's going home to home. She's trying to reach every population for testing. So this is the message she's giving to the other countries, that they can also go for home to home testing measures. And the other countries are obviously populated, like China, India. There are countries which are populated, so they can achieve herd immunity with the help of this kind of testing measures. This is what she's suggesting.
Yeah, delegate of New Zealand. Okay, you don't have to clarify. Okay, so point of personal privilege means China asked you to repeat that line. China didn't ask you for like a clarification of why you said this. So you need to understand, when a point of personal privilege is asked, just repeat the line. You can't clarify in a point of personal privilege. Okay, China, are you satisfied with the answer?
No, could she repeat still the line, what she said exactly?
Just the line, New Zealand, just the line.
Okay. Our prime minister suggested other countries, like she's asked again and again how to tackle this. She suggested that they can go for rapid testing more and more, so that the population can be isolated and herd immunity can be achieved.
Okay.
So point of parliamentary inquiry.
Yes, delegate of Syria.
Sir, in this previous scenario, when China raised a point of order, even if he had mentioned the prime minister said this, wouldn't this point not be in order? Because first of all, herd immunity wouldn't be developed when the entire population has been prone to the infection or has had the infection. It will be developed when 50% of the cases 50% of the population has been infected. And in according to the Royal Society journal, there's a article published in that for specifically for COVID, you need at least 50 to 80% of the population to be infected to achieve herd immunity. So even if he had stated the correct term, that the prime minister, would it not be in order, or would it still be in order?
No, it wouldn't have been ordered, but I didn't got to that far because
exactly.
He mentioned this wrong. The name of the post, he mentioned it as president, and also secondly, these technical things, even if say it's a dicey thing, because this is clearly not in order, but even had it been a dicey thing, had it created confusion or dispute, I would have asked for the burden of proof from the delegate of China. So it wouldn't have been ruled as not in order. I would have taken it in order, but I would have asked for the burden of proof from him. And until I got the burden of proof, I wouldn't have marked on it. So that's
Thank you, sir.
how the procedure would have. Okay. Next, delegate of Philippines, you have the floor for the next 90 seconds.
Thank you, Chairperson, for recognizing the delegation of Philippines. Due to the coronavirus, we are all caught in an inescapable network of mutuality tied in a single garment of destiny. Whatever affects one indirectly affects the all. The delegation of Philippines will take this opportunity to thank WHO for their immense help with all the procedures and guidelines that they provided, which helped Philippines immensely. Philippines also like to thank countries like China, Thailand, India, Russia, and USA for helping us in this grief crisis by ensuring a constant supply of medical kits. The Department of Social Welfare and Development implemented Social Amelioration Program, which targeted 18 million low-income households in Philippines as beneficiaries for emergency cash subsidy. By May 17, this has already reached 95% of its target, providing aid to 17.1 million beneficiary households with peso 96.7 billion worth of cash subsidy distributed. The Philippines Health Insurance Corporation also announced that it would provide peso 30 billion worth of advance payment to its accredited health facilities. With all these measures and above steps and helps that Philippines received, it has recently seen a decline in the number of cases and is currently at less around 2,500 new cases per day as compared to 4,000 new cases earlier, and also reduction in the reproduction number of virus to 0.87, which is way below the
90
threshold of
seconds.
1 at which the virus spreads. Thank you.
Thank you, Delegate of Philippines. Thank you. Points are noted. You don't have any time remaining. Delegate of Venezuela, you're next. Delegate of Venezuela. In the GSL, you are next.
Yeah, I'm audible.
Yes, you are.
Yeah, so the primary thing that Venezuela has done differently from other countries at large, countries that like USA and China, who have actually waited for a substantial number of cases to actually start a pandemic warning in the country, to start lockdown in the country. Venezuela, when the first two cases were reported and the first 2 cases were reported of coronavirus positivity in the country, our president ensured a nationwide lockdown on the people, right? And that is why we believe that we have a much lesser number of cases and a much lesser mortality rate as compared to other Latin American countries, whereas countries with similar population as ours have contracted it much severely, right? And we believe that the way that Venezuela is combating the coronavirus pandemic is by a number of methods similar to this, right? And we urge all other countries in the world to not create a stigma around coronavirus as it is, right? We believe that it needs to be talked about, and this does not need to be stigmatized as it is done in the USA, right? And we believe that this kind of help, this kind of international cooperation, this kind of balance that's required between multinational corporations that essentially produce the medicines and the governments at large that are regulating the sale and the distribution of these medicines, these both need to be in tandem, and we absolutely need to decommercialize the spread, the marketing of these coronavirus vaccines, right? And unless and until these MNCs and governments come into an understanding
90 seconds.
organization, we need to consider into making this a much more wholesome experience altogether. Thank you.
Okay. Thank you, Delegate of Venezuela. Your points are noted. You have exhausted your time. Next, we have the Delegate of Germany.
Thank you, Bert, for giving me this opportunity to speak. As mentioned by the delegate of Cuba, Germany too has a structure in place in case of now global pandemics. We, in association with the Robert Koch Institute, have a national pandemic plan, according to which we divide zones into containment, protection, and mitigation zones. And we've started reopening depending on the level at which these zones are at. And we have expected outbreaks, and we have also been met with outbreaks, but these outbreaks have been contained and regulated so that we may prevent their spread to a national level. The situation has also been contained by re-implementation of lockdown and use of special quarantine facilities and restrictions on transport across these zones. We found that we were lacking in the PPE midway through our first phase of the pandemic, but we have solved that problem through imports and also increased production of PPEs in the country. We have also issued a stimulatory package to recover from the economic backlog that we find ourselves in. And but taking on a global approach to this economic backlog, we suggest that the countries be divided into 2 parts: developed and developing countries, and those with less infectivity ratio and high infectivity ratio, and countries that have reached the recovery phase and that are still in the infection phase. And countries that have reached the recovery phase should start with their reopening guidelines and focus more on their post-COVID recovery, while countries which are still in their high
90 seconds.
should maintain lockdown and also try to prevent increased risk by focusing more on treatment and vaccines. Thank you.
Thank you, Delegate. Your points are noted. Next, Delegate of Italy. You have the floor for the next 90 seconds.
Yes, just a minute.
Okay, Delegate.
Okay, so I'll start. Since the start of pandemic, Italy has been criticized for its response to COVID-19. But I would like to draw the attention of the committee towards some facts. Provinces of northern Italy are the base to many global fashion giants like Prada and Gucci, and their production house in northern Italy is outsourced to Chinese laborers as they are the cheapest in the world. Also, these Chinese laborers were specially from Wuhan. We have flights directly from Italy to Wuhan. Data suggests that more than 3 lakh Chinese workers work in Italy. 90% of them work in garment factories. All of these suggest that there was a solid interconnection of people between Italy and Wuhan. Then the average age of an Italian citizen is 45.4 years, with about 23% of it over 65 years of age. This itself put grave risk to our citizen for particularly this infection. Uh, both these reasons and facts suggest that the virus, before the virus surfaced, it had actually spread to many regions of northern Italy, and from there to the rest of the country. So this was the major reason because why in the initial part of pandemic, Italy has even more deaths than China. Thank you.
Thank you, Delegate of Italy. You mentioned some very good analysis, some very good points and facts. However, what we look forward to is that what you conclude, what you refer to, what are you going to do about these facts? Like you have mentioned a lot of causes, a lot of analysis on why it happened. Now what we expect from you is that what solutions are you proposing from it? Where are you going with these facts? What are you drawing? What conclusions are you drawing from these facts? That's what we sort of look forward to you ideally. You've done one part correctly, absolutely perfectly. You've given the analysis. The next part that I was sort of looking forward from you is that what inference are you bringing from all these analysis? So try to move in this direction from the next speech onwards. Try to show us what can be done regarding this, what solutions you can provide from these analysis. All right, will that be doable, Delegate of Italy?
Sure.
Point of parliamentary inquiry.
Yes, Anurag.
So till,
okay.
Now there's a point of parliamentary inquiry.
Okay.
So till what time would the committee go on today?
12:30.
Oh, okay. Thank you.
Yes, 12:30.
Yes,
Pooja, one more thing. Just a clarification for the delegation of Italy. Italy, you sent a point of order, right?
Yeah.
Yeah, about that, the point of order you raised was a point of order on another point of order, because the point of order raised by China on the New Zealand delegation was not in order. We did not accept it. So because he quoted it to be the president, so your point does not stand. But you, in like normally you can't raise a point of order on another point of order. Is that fine? You can raise a point of order on a speech or on the EB. Is that fine?
Okay, sure.
Thank you.
Okay.
Motion, point of parliamentary inquiry. Would you be taking motions?
Okay, so delegates, ideally we have a little less than 30 minutes remaining for today, and we still need to discuss your working paper and resolution, how to write them, how to draft them, as well as working paper. Now, if the committee decides to go for a committee report at the end of the committee tomorrow and not a resolution, then we can skip the discussion of resolution part and we can continue with the discussion today, and then tomorrow we can just write a committee report. So it is totally dependent upon the committee. So with just an informal show of hands, how many of you want to go for a resolution in this particular committee? This is informally speaking. Just raise your hands.
Point of personal privilege. Could you repeat your statement? I think you were cutting out.
So yeah, so either we can have a committee report like we have in last year's SAMSA WHO, or we can have like a proper draft, proper resolution where we will vote upon. So how many of you want to have a resolution, or how many of you want to have this thing committee report? So people who want to have a resolution, please raise your hands.
I have a point of personal privilege.
Yes.
What is the difference between it?
Yeah, same here.
Oh, okay. So it's my mistake. So delegates, I should have explained it to you. Right. So resolution is something that is binding, that we'll vote upon. If it gets passed, it will be implemented on all the countries that are present in the committee. So essentially speaking, from an MUN perspective, a resolution is something which is voted upon, whether it passes or fails. And a committee report is something which is just the final document where all the sort of points of all the delegates will be put together, and it will be presented in a report form. It won't be voted upon. Just gets adopted by the committee, but it won't be binding on the nations. Its effects won't be binding on the nations. The nations can choose to accept it, the nations can choose to ignore it, but resolution will be binding. If it gets passed, it's legally binding on all the nations, and that's why it's voted upon. So in that regard, if you want to go for a resolution, please raise your hand, and then right now in this session I can explain you what a resolution is and how it is drafted.
Excuse me, point of personal privilege, Russia.
Yes.
Could I please switch off the video? My connection is becoming a bit unstable.
Okay, delegate. Okay, and I completely apologize for my sort of mistake right now. I didn't explain what difference of resolution and committee report is, and asked directly for you to vote. So that is my mistake on my side. I apologize for that. So okay, so 13 people. So most of you want a resolution. That's perfect. So okay, so Anurag, I think right now we should move forward to explain them about resolutions and how to draft. Anurag?
Hello, Ujan, hello.
Yes.
Yes.
Yeah.
A little bit bad reception here. That's why I like.
Okay. Okay. So shall we move forward with it?
Okay. What are they voting for? Are they voting for resolution or the committee report?
Yeah, they are voting for resolution.
Okay, we can move forward with that.
Okay. So Anurag, do something. So right now all chats are suspended. All of you need to look at this currently what I'll be explaining with my screen share. So also, so please don't send any more chats to Anurag. And Anurag, if it's possible, can you turn on your video?
Okay, just wait a sec. Wait.
If the net connection there is okay with you. Okay.
Am I visible?
Yeah, you're visible.
Okay.
Yeah. All right. So going with what exactly a resolution is. So a resolution is something that a committee adopts at the end, and the passing of which will make it legally binding on all the committees. That means if a resolution is passed, the countries that are present in that particular organization can't ignore that resolution. That is legally binding upon them. And hence, when a resolution is tabled in a particular committee, it is voted upon. It is voted with, I think, Anurag, for resolution, it's simple majority or 2/3 majority that we should go forward.
It's 2/3 majority. Resolution 2/3.
So we should be taking 2/3 majority in this committee as well.
Yes, we should be doing that.
Okay. So for resolution, we need 2/3 majority to get it passed. And so ideally, in every committee, there are two resolutions. There can be more than two as well, but generally there are two resolutions with the opposite stances, opposite positions. And if the resolution 1 gets passed, the resolution 2 is then not voted upon. So make sure whoever or whichever block is making a resolution, you are the first person to submit it, so that the first resolution to be submitted upon will be the first resolution to be voted upon. So in that case, if the first resolution gets passed, the second resolution will not be voted upon. If only the first resolution gets failed, then only the second resolution will be voted upon. Now, exactly what is a resolution and how to write a resolution. Okay, so now I'll be sharing my screen. Right, wait a second. So, yes. So is the screen visible to all of you?
Yes, sir.
Okay, right. So essentially, resolutions, they have sponsors and they have signatories. Now, who are the sponsors? Sponsors are the people who write the resolution. Ideally, we can't have unlimited number of sponsors. We can only have 1/10 of the total committee strength as sponsors. So for example, if the total committee strength is 50, we can only have a maximum of 5 people as a sponsor for a resolution. So sponsor is someone who writes the resolution, or in the real UN, it typically means the people who provides money for the resolution to get printed. Is as lame as it sounds. It simply are those delegates, are the sponsors who gives money for the resolution to be printed, so that all the delegates sitting in the United Nations can get a printed copy of the resolution. That are sponsors in the real world. In MUN, sponsors means people who write the resolution, who sort of contribute in the points of the resolution. In real world also, the sponsors write the resolution, but they also sponsor the resolution. They provide the money for it to get printed. Then we have signatories. Now signatories are those people who haven't written the points of the resolution, who doesn't exactly agree with the points of the resolution, but they only sort of want the resolution to be discussed. For example, if you are say Venezuela, and United States have tabled a resolution in the General Assembly of imposing sanctions on Venezuela. Now, as Venezuela, you obviously don't agree with the point of imposing sanctions with you, but you know that this resolution has fraudulent points. So you just want this resolution to be discussed so that you can expose US. You just want it to be discussed. Then you can add your name as a signatory. Signatory essentially means that you want it to be discussed. It doesn't mean that you agree with the points. Signatory can be unlimited amount of signatories, but we need a minimum amount of signatories for this resolution to get tabled. If there are say 1 or 2 signatories or very few signatories, then this resolution won't get tabled. Now, after that comes the topic of the resolution. So this is exactly how to draft a resolution in an MUN. So the topic of the resolution, right? So in this case, the committee that I have drafted this resolution was the United Nations Human Rights Council, and the topic was discussing the status of the rights of sex workers. So this was the topic. In this case, you will write your topic, the COVID-19 pandemic, discussing the effects of the COVID-19 pandemic. Then comes the name of the committee. So, okay, so delegates, I will be sharing this document with all of you. So you don't need to like note down, scribble anything right now. You can just look at it. So the United Nations Human Rights Council, in this case, it will be the World Health Assembly. So you will write the name of your committee, then put a comma, and then you will start writing the body of the resolution. All right. So the body of the draft resolution is divided into 2 parts. One is called the preambulatory clauses, and the other is called the operative clauses. Okay. So what are the preambulatory clauses? Right. So the preambulatory clauses are clauses where the delegates are stating what has been done in the past. They are recalling what has been done in the past. They are sort of setting a precedence of what has already been achieved or what has already been adopted. So here I've written recalling the Universal Declaration of Human Rights, the International Covenant on Economic, Social, and Cultural Rights, and the International Covenant on Civil and Political Rights. So in this resolution, I am not creating the UDHR, the Universal Declaration of Human Rights, or the International Covenant on Civil and Political Rights, the ICCPR. I'm just recalling that they're already present there. They're already there in the international community. They're already there in the United Nations. Reaffirming the principles set forth in relevant human rights instruments and declarations, including the Convention on the Rights of Child and the Convention on the Elimination of All Forms of Discrimination against Women. These resolutions, these documents are already there in United Nations. I'm just reaffirming, recalling them in the committee. So this is exactly what a preambulatory clause is. You will recall, you will reaffirm, you will sort of set a precedence of what is already there. And after that, you will sort of, this will be the preambulatory clauses. And after the preambulatory clauses, you will start to write your own solutions, your own points for the draft resolution. And these are called the operative clauses. So the operative clauses are the clauses where you yourself are suggesting new points, new solutions to the entire committee, which has not been done before. So I'll be coming to how to draft the preambulatory clauses and the operative clauses. So the operative clauses, you can see, recommends the member states to introduce policy and national framework to safeguard the rights of the sex workers, further recommends the member states to address violence against sex workers, emphasizes on the importance, recommends the member states to conduct sensitization workshops, further recommends the governments to take effective steps suggests the governments to use the existing WHO recommendations, further suggests, requests the international community, further recommends, and lastly, further suggests and recommends the international community to strengthen partnerships regarding capacity building projects. Right.
Point of personal, sorry to interrupt. I actually dropped off the meeting because of the connection. So just could you explain last 2 minutes? Could you repeat that, please?
Right.
I actually dropped off.
Yeah. So no issues. So I was explaining what preambulatory clauses are, and then I went to what operative clauses are. So operative clauses are essentially what your solutions are, your points are, what you want to suggest, what you want to recommend to the entire committee, points, solutions that have not been done before. So this is the exact difference between a preambulatory clause and an operative clause. Now, how should you draft a preambulatory clause and how would you draft an operative clause? So there is a list of preambulatory clauses. There is a list of operative clauses. I will be sharing that list to you as well along with this resolution. You don't have to worry. So when you are drafting preambulatory clauses, you need to write what has been done in the past. You need to write what all documents are there, what steps have been taken in the international community regarding this particular agenda. You don't have to write like 20, 30 preambulatory clauses. Preambulatory clauses, you can write 3, 4, 2, just don't write just one preambulatory clause. You can write anywhere. You can write 5 preambulatory clauses, 4. You can write 3 preambulatory clauses. You can write as less as you want. So there is no like hard and fast rule that you need to write certain amount of preambulatory clauses. While writing the preambulatory clauses, make sure that the first word of the preambulatory clause is in the first letter, recalling R, is in capital, it's in italics, and it's underlined. So the preambulatory clauses needs to be in italics, the first letter should be in capital, and it should be underlined. And after every preambulatory clause, there should be a comma. There should be a comma. See, all the preambulatory clauses have commas. So after the preambulatory clauses comes the operative clauses. In case of the operative clauses, again, there is a list of operative clauses that you can choose from. I'll be suggesting that list as well. The main difference you can see is that the preambulatory clauses doesn't have any number or naming in front of them, but the operative clauses have them. It's because the operative clauses are the main sort of points of this resolution. These are your points. You have suggested these points in the resolution. They are your original points. So you should write them as 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, or you can write them as A, B, C, D, right? So in the operative clause, you should begin with the operative clause in capital and in italics, but you should not underline the operative clauses. The operative clauses are not underlined. After the end of the operative clauses, you see in case of comma, I have used semicolons. I have used semicolons beside all the operative clauses, except for the last operative clause, I've used a full stop. Now there's a reason for that. All the operative clauses needs to end with a semicolon, and at the end, there should be a full stop. The reason is that this entire draft resolution, starting from this heading, draft resolution, to the absolute final operative clause, there should be just one full stop. There shouldn't be a full stop anywhere in between any of these lines. You see, sponsors, it ends just like that with nothing. Signatories, it ends just like that with nothing. Topic, also it ends with that. When you write the name of the committee, it ends with a comma. All the preambulatory clauses end with a comma, and the operative clauses end with a semicolon. And at the end only there is a full stop, because this entire draft resolution is essentially just one single sentence. So an entire draft resolution has to be one single sentence. If you put a full stop anywhere in between, say you put a full stop after this third preambulatory clause, or say you put a full stop after this fifth operative clause, you put a full stop anywhere in between the ending and the beginning, the draft resolution ends then and there only. After the full stop, we won't be recognizing any other point that's written after a full stop.
Jen,
yes.
I just had a doubt. Everywhere in UNA, USA, all operatives are underlined.
Okay. So do you have a document regarding that? The UNA USA long form document or the UNA USA official?
like everywhere I read, they always say the operators have to be underlined. Like if you see the sample documents also.
Right. But the fact is that there are sort of no written rules regarding this that they should be underlined or not. Similarly, all the committees that I have delegated and I have chaired, they have like asked we have as practice adopted this practice to underline the preambulatory clauses and not underline the operative clauses. So there are no hard and fast rules for that. I would suggest you all to go with this particular format because of the amazing experience that I have had so far in multiple circuits of India. Generally, the operative clauses are not underlined. Now, since there are no hard and fast rules, you can underline this as well, but I won't suggest to go for that because the standard practice suggests otherwise. The preambulatory clauses are underlined and the operative clauses are not underlined. So, Anurag, what is your take on this?
I think the point raised by China is like the common custom which happens in model events. Most people do that, but I don't think it's like obligated.
Yeah.
It's not It's not any obligation, so we can choose not to do that. Not a issue.
Okay. So as I was mentioning, if you put a full stop anywhere in between, say you put a full stop after point 4, everything you've written after point 4, point 5, 6, 7, 8, 9, 10 to 13, all these points will get null and void because after the full stop, nothing is entertained. So this entire resolution needs to be one single point, one single sentence. Lastly, what I was telling you is that this entire draft resolution can have n number of points. I have included 13 points as operative clauses. You can include say 100 points as operative clause if you want. You can include say, even 1 point as operative clause you want. There is no limitation on how many points you can include as preambulatory clause or operative clause. You can include n number of points as preambulatory clauses and as operative clauses. There is no restriction on that. There is no minimum number, no maximum number. It's totally upon the delegates, right? And lastly, if you are suggesting any particular framework, if you're suggesting any particular model which you can't write in the format of this particular draft resolution, you can include an annex at the end of the draft resolution, and in that annex you can write that particular model, you can write that particular mechanism that you're suggesting. So as an annex, if you want to provide any further information regarding any particular solution that you want to give, you can use that as an annex. You can write that recommends the member states of the World Health Assembly to adopt the framework suggested in Annex 1. And in Annex 1, you can write that entire framework as per you wish, as per your own sort of format. You can include n number of annex. You can include Annex 1, Annex 2. That means you can include n number of extra documents with a resolution if you want to. So this was overall the format of the draft resolution. When you are writing a draft resolution, so it has to be draft resolution 1.0. So the country or the block that is submitting the draft resolution first will become the draft resolution 1.0. The country or the committee that the country or the block that will be submitting the draft resolution next will become 1.2 2.0. The next one will become 3.0. So this is how we'll number the draft resolution, and based on how many amendments are made on this draft resolution will become 1.1 or 1.2. If say 2 amendments are made on this draft resolution, then this draft resolution will become 1.2. If 3 amendments are made, then this will become 1.3. And if this draft resolution passes, then this draft word will be eliminated and it will simply become resolution. Before it gets passed, it's a draft. After it gets passed, it will become a resolution. So
also, Ujan,
yes.
let them know about the friendly and unfriendly amendments and the number of unfriendly amendments which will not make the paperwork pass.
Yeah. So will you? So Anurag, will you take it from here and explain them the amendments?
Actually, I'm having a little bit trouble with the internet.
Okay,
Ujan, I recommend you do it because the connection is going on and off. That's why.
Okay. Sure. Right. So next we'll be coming on amendments. So what exactly are amendments? So right now we mentioned that, okay, before that, delegates, I have said so many things till now. I would ideally be looking for questions or comments or observations. Do you have anything to say, any questions to ask, any clarifications, anything?
Point of parliamentary inquiry.
Yes, Delegate of Syria.
Sir, regarding these resolutions, would these resolutions be voted on as a whole, or would each amendment be voted on separately?
Each amendment be voted on separately, Delegate.
Okay. And
Point of
would
parliament.
it? Sorry, go ahead.
Yes, Delegate, point of parliamentary inquiry. Who raised that?
Right. Since we are not going to be able to communicate with other countries after this committee is over, can we directly message them? Or
Yes.
because.
Yes, absolutely. There is
Right.
no other option than that.
All right. Thank you.
Yes. All right. So, yes, other questions?
Point of parliamentary inquiry.
Yes, Delegate of Oxford.
So I wanted to know that if second block, like as you said, the first block has passed a draft resolution 1.0, right? So if it is the second block, then should it be 2.0, or like he'll also say, like the group will say about 1.0
No,
only?
the group will just write draft resolution and we will number it. The executive board will number it.
Okay. Thank you.
Yes.
Point of parliamentary inquiry.
Yes,
Yeah, sir. Would it be 2/3 majority or simple majority? Because I'm seeing in rule number 32, amendments require a simple majority, that is 50% plus one.
Amendments will require a simple majority, but the resolution will require 2/3 majority.
Okay.
Yes, and also what is written in rule number 33, Delegate?
Suspension of the rules.
Yeah. So if at any point, so that is I refer to that point because that is another point that we might use at some point in the committee. At the discretion of the EB, we might tweak the rules a little bit if we see that the resolution discussion and debate needs, a sort of modification in the rules of procedure.
Of course. Thank you.
Yeah. So 32, as you mentioned, is right, but for the resolution, we'll be taking 2/3 majority. Yeah. Thank you. Right. So are there any more points?
Yes, point of parliamentary inquiry, Russia here.
Yeah, Delegate, go ahead.
My question is that for the resolution to be passed, we need 2/3 majority. So once the resolution is, for example, if the resolution fails, do we can we make an amendment to that resolution, or you have to draft a completely new resolution?
No, I'm coming to amendments. Amendment is not made after voting; it's made before the voting.
Okay.
So I'm coming to amendments as well. And yes, if one resolution fails, again, if there are multiple resolutions, then the second one will be voted upon. If the second one also fails, then like we don't have the option of creating a third resolution after all the fails. All the resolution have to be submitted together. And if all of them fails, then it's okay. It's like not an issue. Like it's not an obligation for the committee to like draft a resolution. If it happens in the real UN as well. So resolutions committees, they do end without resolution. In that case, we'll have like a substitute document, a committee report or something. Okay.
Okay, thank you.
Are there any more points on the floor?
Point of parliamentary inquiry by delegation of New Zealand.
Yes, Delegate.
What are we supposed to write under the column of sponsors and signatories? Like, are we supposed to write it of our own, or we'll get some document for that? We don't know at present what are the sponsors, who are the sponsors and signatories.
Yeah. So ideally, how you will proceed is that after this session is done, after today is done, we will look forward for you to make blocks to form resolutions. Now, say, Delegate of New Zealand, you have selected 5 delegates as your block members. And like these will be informal blocks. Then you don't have to like register it as an official block in the committee. So you and your ally states will form a resolution, will write a resolution. And since you have written the resolution, you 5 of you will be the sponsors. So sponsors will essentially be those people who have written the resolution. You getting what I'm saying right now?
So we need to interact with other delegates and we need to get to know that within today itself, right?
Yes. Okay. That is the burden of writing a resolution, that you need to interact with other delegates to form a resolution. However, that doesn't mean that you can't write a resolution on your own. You can also write a resolution on your own, but if it doesn't have the required amount of signatories, then I'm sorry, that resolution won't be tabled. So the required number of signatories also need to have a minimum amount of signatories. So we suggest that rather than writing resolutions alone, you can write it alone. It's not against the rules. It's totally with the rules. 5 people can write a resolution. One can also write a resolution. But we suggest that you write it as a block, because then that will sort of signify your stance that no, the points that you are suggesting, other delegates also feel the same way. And also, if you write it as a block, you can gain more signatories. Because trust me, gaining sponsors is not a difficult thing. You will find plenty of people who is willing to sponsor a resolution, but gaining signatories is a very difficult thing.
All right.
Yeah. So in order to gain the required amount of signatories, try to have the maximum quota of sponsors, right? So any more questions on what are sponsors, what are signatories?
One more thing.
Yeah.
Chits are suspended for now. Like, don't send me the chits. I won't be forwarding it to the chairperson.
Absolutely. So chits are suspended for now. Please listen to these things. Right.
Thank you.
So if you have any more questions, we can all take all these questions. Any more questions, delegate?
Point of parliamentary inquiry. What are the minimum number of sponsors and signatories?
Yes. We'll be coming to that. So today the minimum amount of okay. So Anurag, are you listening right now?
Hello, Ujan, hello. Am I audible? Hello.
Yeah.
Hello.
Yeah. Yeah,
Yes,
you're audible, man.
Yes.
Anurag, sir. Yes, you're audible.
Hello, Ujan. Are you saying something, Ujan?
Anurag, sir. Okay. So the total number of delegates in the committee today was 18. Right. So technically, as per UNA USA, we can have 1/10 of the total committee strength as the maximum number of sponsors. So if 18, we can't have like 1.8 delegates. Rounding up, it should be 2 delegates. 2 delegates maximum for the sponsors, but 2 delegates would be really less. And since this is a committee for mostly filled with beginners and less experienced people, so Anurag sir, can we increase the minimum number of sponsors as the discretion of the EB to 4 delegates?
Hello, am I audible now? Hello?
Yes, you are.
Yes, okay. Am I visible also?
Okay, I'm not in full screen. Yeah, you are.
Okay.
Yes, you are visible.
Okay. Yes, Sujan, what were you asking? Sorry.
So technically, the total number of sponsors for this committee can be 1.8. The maximum.
It's 1/10, na?
Yeah, 1/10. So it can maximum be 1.8, right? So 1.8 can't be the number. So it can be 2. Maximum of 2 sponsors can be the maximum number of sponsors. So for the betterment of the committee, can we increase the number to 4? Because
most are first timers only. So I think it will be much more easier for them. Committee, let's ask them only. Is it fine with you guys? You're fine with 4 speakers for one resolution?
Yes.
I think 3 would be nice. 3 would be better.
They want 3, Ujan. So
2, 3, all are okay.
Should we have a vote, Ujan?
Okay. Okay. So delegates, delegates wishing to have 3 sponsors as the maximum for the resolution, please raise your hands. Okay, we are waiting.
We have only 6 votes.
Yeah.
New Zealand is raising hand in the chat. One, 2, 3, 4, 5, 6, 7, 8.
Okay, so we have 9.
We have 10, including New Zealand.
Okay. So most of you want 3 as the maximum number of sponsors. So fine, I'm fine with that. So Anurag, we won't be having then 4 as the maximum.
Okay, 3. Why such a specific number though? Have you guys already formed blocks? China, I heard you were the most disruptive. What have you guys done? Made groups of 3 and all. Trio. That's fine. We can have 3. Not a problem if you guys want it. It's your wish. Okay, Ujan, we'll be going with 3 then.
Okay. and the signatories. So Anurag sir, we need to fix a number of signatories for this committee.
I think the number is changing. The number of participants. Yesterday, we had 22. How much should we have?
And that's why I'm telling you, for this particular resolution part, we can't stick to the formal like rules of procedure, because the rules of procedure for resolutions are very strict, but the committee strength is changing every day. So we need to use our discretion in this case, at least. Signatories, how much shall we keep?
Normally, we keep like what, 1/3 or 2/3? What do we keep?
Signatories were 1/3.
1/3 we keep, yeah.
Yeah.
So 1/3 of 18 is 6. So 18 does it, no? We have 18 participants. 1/3 of 18 is 6.
So yeah, I mean, okay, we can fix it at 6. But if tomorrow the number of participants reduce, then it might.
Yes, that is also a question. Then what to do? What to do?
Let's
keep
keep
it
5.
Okay, five will do. 5 will do. Yeah.
Okay.
5.
Okay. So generally, there are 1/3 of the entire committee needs to be signatory for the resolution to be tabled. However, in this case, you need a minimum of 5. Minimum. This is not maximum. A minimum of 5 signatories for us to table the resolution, and a maximum of 3 sponsors. You can't have 4 sponsors, and you can't have 4 signatories. It has to be 3 sponsors maximum and 5 signatories minimum for you to table the resolution. So that solves that question. Next,
Also, some of the very smart people don't think that you can sponsor and be a signatory to your own paper. Some of you might think that you'll just do it in case you don't have support in committee. Don't do that.
No.
That will look very stupid.
Yeah.
Don't get support from the committee.
You can only be sponsor.
Yes.
If you're a sponsor, you can't be a signatory. Oh, and yes, another
Yeah,
thing.
Chujan, go ahead. Yeah.
If you have sponsored a resolution, you can also be a signatory in the resolution of the other guy, of your enemy. Because being a signatory doesn't mean you support your enemy's resolution. Means that you want your enemy's resolution to be discussed, so that you can sort of annihilate his stance or anything like that.
Yes.
Right. So finally, coming to amendments, Anurag sir, you are visible right now. So would you be doing the amendment part, or shall I take it forward?
Sir, you do it, because I don't know how to share my screen.
Okay. So amendments, even I wouldn't have been sharing my screen as well. So, all right. So amendments, generally, there are 3 types of amendments.
So we could have shown them the PDF though.
I actually don't have the PDF amendment for PDF right now. I was showing the resolution that I have made.
Effort. So I think as growing up, I've always wanted to become a medical doctor. I've always dreamed of becoming a doctor. I would want to help people.
Who has the dream of becoming a doctor? Please tell me now. Who? I want to know. I want to see the dream. Who's spamming? I love it. Who's doing it?
Not just to see 1 or 2 patients, but rather
whose audio is this?
as my patients. So that's why I
Whose lecture is on?
Is it Shahsa?
Because I think it's the most important.
I guess another session is going
How did we do that? So
no, mine is
Malaysia.
not on.
I joined the workshop in Mumbai, and going back to Malaysia.
Well, we are not in Mumbai. We won't be doing the workshop.
There was a teacher flown all the way from Cambodia.
Please check your mic, mute yourself.
This feels just like an online class. No one's listening.
Because
everybody's doing this
from
thing.
medical background and
Then you finish writing.
So
please mute yourself.
From the medical perspective, in Cambodia, apart from education.
It's very funny.
Sahasra, can you mute yourself?
Yes, she did. Okay, that was
Yeah,
Sahasra then. Very good.
Okay, it's okay. There was someone among us. Let's not discuss this right now.
There's one imposter.
Okay. So there are amendments. So what are amendments? Amendments are essentially your power, that as a delegate, that you have a power to make changes in these operative clauses of the resolution. You can see these operative clauses in a resolution. You can make amendments to change these operative clauses. You can't change the preambulatory clauses. You can only change the operative clauses, because these are the ones that matter. Operative clauses will be the ones that will be implemented. Preambulatory clauses have already been implemented in the past. So you can make amendments to change these operative clauses. So there are 3 types of amendments. One is deletion amendment. You can simply write from, say, delegate of USA, to the executive board, you have to write deletion amendment at the top, and then you have to write deletion of operative clause 2. You don't have to write the reason. You don't have to write why you are deleting it. Just deletion of operative clause 2, and then we will put that amendment into vote. How an amendment is voted, we will first ask the sponsors of the amendment whether it's a friendly amendment or an unfriendly amendment. If all the three sponsors say it's a friendly amendment, then that amendment gets passed. If even one of the sponsors say that it's an unfriendly amendment, then that amendment is put into vote. And in voting, if 50% plus 1, that is simple majority, votes for the amendment gets passed and operative clause 2 is deleted from the resolution. And if majority denies this amendment, then the operative clause 2 stays. So that is the deletion amendment.
Ujan, what was the vote needed for an amendment? Wasn't it 20%?
Amendment, I'm sorry?
No, for an unfriendly amendment, wasn't it 20%?
Unfriendly amendment, it has to be like 50% plus 1, simple majority of the
I thought it was 20% UNUS. Okay, I think we should go through, you sure 50%?
I mean, voting of amendment is simple majority. It's not 20%.
Voting of amendment is, but for it to be reenacted in the actual draft resolution, I think it's 20%. I'm quite sure about it.
Oh, so you are sure about this part?
Yeah, I'm sure because I read it in the UNUS ROP.
Okay. Then it's sure. Then I'm making a mistake in this regard. So then, how many people do we need for the amendment to pass?
For an unfriendly amendment, I know that it's 20%. If it's
Yeah. So it's an unfriendly amendment, then 20% of the people would need to vote yes for it, right?
Yes.
Okay, so it will depend on tomorrow how many people we have tomorrow.
Yes, that's a concern. Yes, 20%. Yeah. 80.
Okay. So as Anurag sir pointed out, so 20% of the people, 20% of the committee strength would need to vote for an amendment in order for it to get passed. Right. Now, next we have is modification amendment. Modification amendment is something where you want to modify any of the existing amendments. Say you want to modify amendment number 5. So you have to write from USA to the executive board. At the top, you have to write the heading modification amendment, and then you have to write the original amendment. Amendment number 5 within inverted comma further recommends the government to take effective steps enhancing the community empowerment among sex workers. And then at the bottom, you have to write the modification of the amendment. That is the modified amendment that you want to write. Further recommends the government to take effective steps enhancing the committee empowerment as well as the various levels of government body amongst the sex workers. So you have not just included enhancing community empowerment, but you have also included the empowerment of the various levels of government bodies, which deals with the women's empowerment and women's right. So you have essentially not deleted the amendment, but you have modified the amendment. Now there is another form of modification, that is, if say amendment 5 have subclause A, it has then it has subclause A. Okay, so for some reason it has subclause A, then it has subclause B, it has subclause C. Now this is another thing, in a resolution below a point you can also include subclauses. Clause 1, subclause A, subclause B, subclause C. You can also include subclauses, that you can also include. So if there are 3 subclauses, say A, B, C in clause 5, and you want to delete one of the subclause, say you want to delete subclause A, then that won't be a deletion amendment, that will be a modification amendment, because you're modifying the clause, you're not deleting the entire clause 5, you're just deleting subclause A. So you are modifying clause 5, and in that modification you have to write the entire original amendment with the subclauses, and then you have to write the modified amendment by deleting the subclause that you want to delete. So this will be another form of modification amendment, deletion of subclauses. But you don't have to write deletion of subclause, you just have to write the original amendment, and you then have to write the modified amendment with the subclause being deleted. So there goes modification amendment. Lastly, addition amendment. Oh yeah, so in case of modification of amendment, you don't have to write the entire original clause. You can write, say, the first 2-3 words, then you can use ... and then you can write the last 2-3 words within inverted comma, and then you can write your entire modification amendment, your entire modified clause. But in case when you're writing the modified clause, you have to write the entire clause. The original clause you don't have to write. You just can use dot dot dot, and then you can just write the last two three words. You can write the first two three words, you dot dot dot, and then write the last two three words. And then while writing the modified version of the amendment, you have to write the entire amendment, your entire modification. Right. The last is addition amendment. So the addition amendment is as it refers, it will be an addition amendment. If you want to add a particular clause in this moderated clause, in this resolution, you have to write, since there are 13 clauses, you have to write addition of clause number 14. Say if there are 9 clauses in the resolution that is tabled in your committee, you have to write addition of clause number 10. So it will be the last number plus 1. So if it's 8 clauses are added, you have to write addition of clause number 9, and then you have, within inverted comma, you have to write what clause you want to add. And these 3 will be the 3 types of amendments. Right. So the amendments, we will take all the amendments together, but the order of the amendments will be, first we will be discussing upon the deletion amendments, then we will be voting upon the modification amendments, and then we will be voting upon the addition amendments. So this will be the order of the amendments that they will be taken upon. So firstly, we'll ask the sponsors whether it's a friendly or an unfriendly amendment. If all the sponsors say friendly, the amendment passes. If even one of them say unfriendly, the amendment goes into formal voting. And in formal voting, we if there are 20% of the delegates, they say yes for the amendments, the amendment passes. And if 20% of the delegates say no, then the amendment fails. So that's how the entire amendment procedure will go. And based upon how many amendments we had, we will modify this number. If we had 3 amendments to the resolution, we will be having 3, we'll be writing 1.3 here. Now there is one more practice that is adopted in MUNs. If 2/3 of the resolution is amended, that means 2/3 of the original resolution doesn't exist anymore. 2/3 of the resolution has been amended, then the resolution automatically gets scrapped, because the original resolution is not there anymore. Most of it, majority of it has been amended. So it's a new resolution. So in essence, the original resolution doesn't exist anymore. So this resolution gets scrapped. So here also, Anurag sir, shall we apply this rule here as well, or shall we leave it to the delegates, whether they want to scrap a 2/3 amended resolution or not?
I think we should keep it now, because some like a block might form like 20, 50, 30 clauses. The other might just write 10 clauses. So shouldn't we keep this? I think it's a standard procedure. I think we should keep it.
So we should scrap a resolution after 2/3 of it gets amended, right?
Yeah.
Yeah. So as Anurag sir rightly said, it's a standard practice. Again, it's not like a written rule, but it's a standard conventional practice. So if 2/3 of the resolution gets amended, the resolution automatically gets passed. So the sponsors of the resolution, be very careful when amendments are being voted upon your resolution. Don't let 2/3 of your resolution get amended. Otherwise, it will get scrapped. Okay. So I've said many things regarding amendments and everything. Any questions? Any questions regarding amendments, resolution? Yes.
Point of parliamentary inquiry. Yes. I want to ask, what is the marks distribution for amendments that we make in other reports, like other draft resolution? If we raise an amendment in some other country's report, then what is the marks distribution that we get? There must be some marks, no?
I think so for the conference time, I think we'll do that post conference. Is that fine, Ujan?
Yeah.
Okay.
Yes.
So, point of parliamentary inquiry.
Yes.
Sir, if we need to add a sub-clause to a clause, would it be a modification amendment or addition amendment?
Yeah, if you are tampering with a sub-clause, if you're deleting a sub-clause or adding a sub-clause, it will always be a modification.
Okay, thank you.
So addition will only come into effect if you're adding a whole new clause. If you're adding, say, clause 1, sub-clause C or sub-clause D, it will be a modification. If you're adding a completely new clause, so you're adding clause 11, then that will be an addition amendment.
Okay.
Any more questions? Okay, so one thing, are you guys wondering how to write these like operative clauses? Because you have to write these on your own. These are your own like original solutions. So that's very simple. You just have to jot down your solutions that you have like made in the committee in order, in 1, 2, 3, 4 order, and then before that solution, you have to add one of these operative clauses and make sure that it is grammatically matching with the solution. So you just have to write your solution in points for 1, 2, 3, 4, and before every solution, you have to include one of these operative clauses and make sure that it's grammatically matching. It's extremely simple. There's nothing really complicated about writing a resolution. Writing a resolution is one of the most simpler things in an MUN. If you just keep these operative clauses in order and you just write the right operative clauses, it is one of the most easiest things. So you have your own solutions. I will provide you the list of the operative clauses. You just have to merge your solutions with the operative clauses, put it into italics, and that's it. Use semicolon at the end, don't use full stop, and that's it. Your resolution is ready. So I will be sharing the screen for the operative clauses. Right. So, okay, so I'll be sharing this entire document with you, but just take a look. These are the preambulatory clauses. See, acknowledging, acting, affirming, alerted by, alarmed by, expressing.
Ujan, it's not showing. Ujan,
it's not showing.
We can't
I
see.
think you need to reshare the screen.
Yes.
I'm sorry. I'm really sorry for that. Wait a second. I'm sharing again.
Also, guys, don't plagiarize. We'll know.
Yeah.
Don't plagiarize from UN resolutions. We'll know. We have
Yeah.
seen more than enough, and we'll know.
Yeah.
Yeah. Here.
So plagiarism, it like happens a lot in MUNs. Operative preambulatory clauses are plagiarized. You don't have to plagiarize. If you see a good point, a good clause in a particular resolution, you just paraphrase it. You paraphrase it and write it in your own words. That way you can take help from that resolution and you won't get caught as well. So just paraphrase if you find a good point and write it in your own words.
Be a good cheater.
Yeah. So you can see, if you can see my screen right now, you can see that the preambulatory clauses are acknowledging, acting, affirming, alarmed by, see, reaffirming, see, fully aware, fully believing. These are clauses which states that there already has been work done before and you are taking these works into account. So that is exactly preambulatory clauses are. You're not suggesting something new. You're just making the committee aware that something in this field has been done before. You are taking these things into account. And now look at the operative clauses. Accepts, affirms, calls for, also recommends, also calls for, see, calls for, commends. One of the most commonly used one, recommends.
Recommends.
Where is that one? Suggests, recommends, calls for. These are some of 3 of the most commonly used operative clauses. Supports, further recommends, further calls for. These are suggesting actions, these are actions that you want this committee to take. These are not things that have been done before, but these are actions that you are suggesting you want this committee to take. And hence these are operative clauses. You need to use any of these clauses in front of your own solutions in the operative clause part.
Yes, one more thing, Ujan. Also, guys, when you are writing the operatives, don't repeat them. Don't just write suggest this, second point suggest this, third point suggest this.
Don't repeat
that
them.
You can do alternatively. Suggest, then regrets, then again suggest, again regrets. Yeah.
Further suggests,
yeah.
further recommends. Yeah. There are many options to choose from. You don't have to repeat, like you can see so many options. You can choose from a plethora of options so that you don't have to repeat. If you repeat, then the resolution becomes monotonous and then it might not get voted upon. Yeah. So I'll be sharing this document with you as well. So now I'll stop sharing my screen. All right. So that was all about resolution. I can see many confused faces. Delegates, questions. Do you have questions? So the
point of parliament inquiry.
Yes.
Shall we make it from beforehand or after tomorrow's discussion complete? Shall we make it?
Yeah. So tomorrow we'll be discussing upon the resolution. So ideally, you should sort of start making blocks and start making the resolution from tonight only, so that in tomorrow's committee we get the resolution and have enough time for it to discuss.
Yes. Okay. Thank you, Chair.
Okay.
And when shall I submit it then?
I'm sorry.
After when can I submit?
Okay, so
The
tomorrow
resolution.
tomorrow we'll be asking for the resolutions. When we ask it, we will give you enough time. So when we ask for the resolutions, then you can submit the resolutions.
Okay, thank you, Chair.
Also, Ujan.
One
Okay. Go ahead. Yeah.
Yeah.
Go ahead.
and regarding the chits,
yeah,
like people have sent me, delegates have sent me right now also. So what to do with that chits, because it was suspended and still they are
yeah,
sending me
yeah. So
after repeatedly saying them that not to
so
send it.
yeah, absolutely correct point raised, Yash. So these chits will be null and void. I'm sorry, because Yash has specifically instructed all of us to not send any chits, and despite that, we have sent the chits. So I think Yash's decision will be final here, since he's the one in charge of chits. If he decides that chits are suspended, then it has to be suspended. We have to respect that. So the chits that have been sent during this session, Yash will make it null and void, and he has the full prerogative to do that. So Yash, you can move ahead and make them null and void.
Yash OP.
Yeah. So finally, we can, so regarding the discussion of the resolution will be discussed clause by clause. That means we'll be sharing one clause in the screen, and on that clause, the delegates will be asking questions to the sponsors, and the sponsors will be providing the answers. So the questions might be directed to any one of the sponsors. It might be directed in general to all of them. But ideally, if it's directed to all of them, generally we would recommend one of the sponsors to answer the question on behalf of all the sponsors, so that so that we don't have to waste like a lot of time in one particular clause only. Lastly, uh, preambulatory clauses won't be preambulatory clauses will be read out, but it won't be discussed upon. Preambulatory clauses won't have any questions on them, but we will be checking the preambulatory clauses for plagiarism. So that will be done on behalf of us, because a lot of plagiarism goes into making preambulatory clauses, and we won't be allowing that.
Also, Ujan, one more thing. There's also common practice where if they like send an amendment for deletion of a preamble clause, we delete the entire draft resolution. I don't think we'll be doing that.
Absolutely not.
That's very
Absolutely
inconvenient. Yeah.
Yeah. So if it's a deletion, so also one more thing, why would you be wanting to delete a preambulatory clause?
Many people think they are street smart. They do it.
Yeah,
They send in amendments. This has
that
happened to me. I've been a victim of it. That's
yeah, that's a very common practice. Even I have also chaired a school committee, and I've seen that's a very common practice in the school circuit. But in the college circuit, I don't find this thing. But in the school circuit, a lot of people does that. What will you get by deleting a preambulatory clause? Preambulatory clause won't be like binding upon any of the nations anyway. It's just there to let you know. So use your time wisely and only focus on the operative clauses: deletion, modification, amendment, and asking questions on them. Right? Preambulatory clauses will be there. We'll read it out and we'll see for plagiarism, but they won't be discussed upon. So that goes everything regarding the draft resolution. Anurag sir, if you can just briefly explain them what is working paper, because I really badly need to go fetch some water right now.
Okay, sure. Just a second. Am I audible? Hello? Just a second. I'll just switch on my charger.
Yes, Anurag, we can hear you.
Okay, so yes, Shorodipto?
Yes, now am I audible?
Yes, you are.
Yes.
Hello. I can't hear you guys. Hello.
Yes. Turn up your volume if that's required.
Maybe he's facing some issue with the connection.
Okay. So I'll just briefly touch upon
Hello. Can you see me now? Hello, am I audible? Yes, I can hear Ujan. Anybody else speak?
Yeah, you're audible.
Yes.
Okay. Basically, we were talking about a working paper, right?
Yes.
Okay, so guys, working paper is nothing but it's rather informal piece of document. It's just your solutions, but usually in model events we don't keep any particular format for working papers. It's generally the discussions you had now. Yesterday you had discussions, we had points, we had so many questions and all. It's basically summarizing your entire points of discussions into like point by point form. Everything you discussed, anything that adds to the agenda, you laid out in a working paper. you have sponsors, you don't even need signatories, I think. Do you
No,
need?
no,
I
no.
think you don't need signatories. You just put your sponsors, you write the points that these are the discussions made in the committee, and yeah, that's a working paper for you. You don't add
Yeah.
anything new. You just put whatever has been discussed in the committee in the past. That's
Yeah.
it. That's the end of it.
That's it. That means your solution that you want this committee to move forward with your proposals, and that will be an informal document. And
Yes.
also, Anurag sir, there won't be like a maximum number of sponsors or signatories required,
No,
right?
no.
Minimum signatories. None of that will be required. So working paper doesn't require any of these. And lastly, the working paper can be from a single delegate. It can be from a block. It can be from 50 delegates together.
All the delegates, yeah. All of you do
all
that.
all
Yes.
the delegates together. It can be from one delegate. So working paper is totally flexible. You can draw graphs, charts, anything in the working paper. There are no formats. You can draw pictures and send us. So it's basically an informal piece of solution paper. That's it. You don't need, you can write it alone. You can write it with 2 people. You can write it with 3 people. Just try to not send us multiple working papers. So if you are a delegate of USA, just try to not send us 2 or 3 working papers from the USA. That will be really inconvenient. Ideally, you should put down all your solutions in one working paper. Also, if you're drafting a working paper together with another delegate, try to make sure that you're sticking to one block. You're not drafting multiple working papers with multiple blocks. Then also that will also put your own position into contradiction. So these are diplomatic factors that you need to keep in mind. So try to send one working paper from, like, one delegate should be part of just one working paper. That will be the diplomatically, best position for you.
Just Ujan, to add something to that, what Ujan sir said is absolutely right. But also keep in mind, when you are a part of a draft resolution, you're a part of any block, or you're drafting a working paper, make sure the co-sponsors you have, right, your other fellow sponsors who are drafting it with you, make sure that your policy is in alignment, because we'll be marking you on your foreign policy.
Yeah.
USA goes on to draft a paper with China and puts it in committee, we'll be downmarking you like hell. We are saying that in front of you, right?
Yeah.
You see, yeah, just to make sure what's your policy, be well aware of that. Even if you two personally align together very well, you have very good relationship after this also, doesn't matter. Make sure to keep your policy in mind when you're drafting the paperwork.
Absolutely. So that's it from us. Any questions regarding working? So working paper resolution, ideally you should start working on this from tonight. So after this committee ends, you should put your diplomatic and negotiation skills into practice. You should lobby with the delegates informally through texts, through WhatsApp, and then start creating your blocks and start preparing your documents. Working paper we can have from the beginning of tomorrow's committee only. You can send it as a long form chit to Yash sir, and Yash sir would forward it to us, like he does regarding all the chits. So you can send it to Yash sir as a typed message, and he will forward it to us. If it has like graphs and charts and everything, you can just draw a PDF of it, make a PDF of it, and send it to him in WhatsApp, and Yash sir will forward that PDF to us through WhatsApp. Otherwise, if it's just written, you can also send it through WhatsApp or through this Zoom. Send it any way you are comfortable, you are convenient, but you have to send it through Yash sir. He will send it to us.
Also, Ujan sir, one more thing. I think we haven't discussed the voting rights of the University of Oxford or the other pharma companies or the non-members of the WHA. I think we should be discussing that. Do you think?
Yeah. I think Anurag sir, I think we should give equal voting rights to everyone in this committee, because since it's a learning experience for most,
First time was okay.
Yeah,
Maybe
we shouldn't be
okay. That's
we shouldn't be like filtering the observers as separate and non-voting members. Then that way they can't be part of any resolution as well.
Yeah, I think there was an option of special signatory for them, but that's fine. I think we'll allow
I mean
them.
special signatory, but we want everyone to be a part. We want to give everyone that option to be a sponsor, right? So
okay. We'll make the exception. Okay,
we'll make the exception, absolutely. So working paper you can send us at the beginning of tomorrow's committee. The chits that you have to write to other delegates, or you have to reply to other delegates, you can send from tomorrow's committee onwards. And the other chits that you want to send as substantive chits to the executive board, you can send till today 9:30 p.m. That's the procedure we'll be following. All right.
And for the PDF, till what time they can send the PDF?
The PDF for working paper?
Yes.
Yeah. So the working paper you can send from tomorrow, from the beginning of tomorrow's committee. So not tonight. So we will only accepting, we'll be only accepting the working paper from tomorrow's committee onwards.
Point of parliamentary inquiry, Chair.
Yes. Yes.
So I wanted to know that is there any format for working paper? How shall we make it?
No format. Absolutely, you can draft it any way you want. You can write it in points. You can write it. You can draw graph. You can draw chart. You can use a model. You can write it in any format that you want.
Okay. And I want to know that University of Oxford is an autonomous body, right?
Yes.
So do we need to have the go with the foreign policy of UK, or is it like or not? Like as so about USA and China, there it's clash. UK also I've heard that there's going on a rivalry with other countries. So what shall Oxford do?
Yeah, right. So ideally, your policy in this regard would be regarding to your actions, since you don't have like Oxford doesn't have a foreign policy of Oxford as such. Oxford ideally is very critical of the UK government itself. If we look at the debates that go on in the Oxford Union, it's very critical of the UK government itself. So ideally, right now, your policy should be based on what you are working for. You are working for a vaccine, you are working for trials. And if you see that there are countries, there are blocks which are favoring your approach, which are willing to support your work, you
Also pharma companies. Yeah,
also
even pharma companies.
Yeah, you side with them only. And this goes to all the pharma companies.
Okay, thank you, Chair.
Okay, right. So delegates.
Point of parliamentary inquiry. One question is, can we send chits right now? As in within the next 5 minutes. Is it acceptable right now? To the other delegates?
No delegates.
Yes.
Not to other delegates. Today is suspended. You can prepare those chits at the beginning of tomorrow's committee. Just send them one after the other. We'll mark them. You can obviously write these chits today, and then when committee begins tomorrow, you can send them together. So you don't have to waste any time writing them again.
Ujan, if there are no more doubts, I think we should be ending the session. I think Shodhito, Shastra, they have to go on with the other events.
Yeah, absolutely.
Yes, we have.
Sorry for the delay.
No problem.
Yeah, today. Okay, so before ending the committee,
not at all.
I also apologize for
Ujan. It was a very educating session. The last, yeah.
Oh, thank you, Shorodipto. Thank you so much.
Yes, true.
Okay, lastly, before ending, we have said so many things. We would like to hear a little bit, from, some 1, 2 or 3 delegates, what they, feel, any questions, any further comments. Lastly, if we can sort of end this session with the delegates' comments, it will be best. Any delegate wants to say anything? Comments, questions, doubts, observations?
China.
Okay, yeah, China.
I would just request all delegates to, if 2/3 majority is needed, then it would be best if we have lesser number of working papers and one unanimous draft which everyone can collate together.
No, China. Please don't use this forum to advance your own cause, personal cause.
No.
Oh, sorry.
This is not. No,
it was
China.
a comment about committee, not about your personal cause.
Committee was very educative, and thank you for all.
Okay, so thank you, China. Thank you. You can use these diplomatic skills after the committee ends. We would all be encouraging you to use your negotiating skills, your diplomatic skills to put forward your own agenda. All right. So finally, any other delegates have any questions or any observations?
I have an observation.
Yes, Syria.
I think the chairs did a brilliant job at explaining draft resolutions, because even in the previous MENs I've attended, there's a lot of misinformation about it, about preambulatory clauses and operative clauses, and I think you guys cleared it up very well. So thank you for that.
Okay. Thank you, Delegate of Syria. Thank you so much. Any more questions? Ideally, we're now looking for questions if there are any confusions. All right.
A delegate of New Zealand has raised her hand.
Absolutely. New Zealand. Please go ahead, ma'am.
Delegate of New Zealand will like to thank chair members. Like, this is my first MUN session I'm attending, and I'm actually enjoying it. I'm not feeling like it is the first time. I'm not feeling like I haven't done it before. Chairs are really cooperative. They didn't make me feel like there are members who have attended MUN before, but still we are able to interact with them as well, because they obviously has one upper hand. But organizers didn't, chairperson didn't let us feel that. So I'm really thankful and looking forward for more opportunities.
Thank you,
Have you
Delegate.
enjoyed the sessions?
Yeah,
That's
yeah.
one.
Actually, I
Okay,
actually enjoyed a
great.
lot. And I'm suggesting others that why didn't you join this MUN? Like I have a friend who was about to join and he actually backed out yesterday only. So I was he's not doing well. I asked him that yeah, come. They like chairperson says really cooperative. You won't feel that you haven't done it before and all. I forced him so much to come, but he didn't turn up because actually he wasn't able to. But yeah, I'm convincing people.
Ma'am, you are very
Come and join.
kind. Ma'am, you are
Thank
very
you.
considerate.
Thank you. I think if you guys are enjoying, that is sort of serves the purpose of Shorodipto, Sahasra, Yash, Anirudh sir, and all the organizers of SAMSA, because that's what it is all about to enjoy really. So, are there any more questions regarding this draft resolution?
Right?
Yes, China.
There are no chits after committee today, right?
Only to the EB. Only to the EB.
Okay.
Yes.
Thank
South Korea, you have something?
Right. I second New Zealand absolutely. But what I wanted to say is if everybody could introduce themselves in the WhatsApp group so that we can communicate on WhatsApp now.
Okay, okay, that can be done. Okay, delegates. So with that South Korea's comments, we will be introducing all of us in the WhatsApp group. We will be ending today's session. All right. If you have any more doubts, any more questions regarding the draft resolution, you can obviously reach out to us in the WhatsApp group. You can DM us. You can reach out to us anyhow throughout the day. We'll be happy to answer all your questions. So if you want, you can start preparing the resolution today only. That will be that we would suggest that only, because tomorrow at any point during the committee we might ask for the resolution. So tomorrow we might not give separate time for you to write the resolution, maybe 10 minutes, 15 minutes at max during an unmoderated caucus. So best would be to start making blocks, or at least start jotting down your points in a document and start convincing other delegates whether they would be in your allies or not. You don't have to draft it formally, just start the process. That's what we are suggesting. In that way, you will be prepared for tomorrow. When we ask for the resolution, you might give it to us in 15 minutes or something like that. Because since we have only 3 hours of committee tomorrow, we won't be giving separate time for half an hour or 45 minutes for writing a resolution, what we get in an MUN. So if that is okay with you, you can go ahead. Lastly, again, delegates, it's not an obligation to write a resolution or pass it. It's upon you. If you want it, you can. If you don't want it, we can obviously go for a committee report. But looking at your enthusiasm, I believe that you want to go for a resolution. So, Shorodipto, please provide them with further instructions regarding
sure.
the next events and end this meeting.
Also, delegation of Ethiopia just joined now.
Okay, so
Ethiopia, he had some issue with the connection.
Okay. So
meanwhile, I'll just give the schedule for the today's conference. So currently we are having the original research poster presentation and case history presentation of medicine. From 3 p.m. we'll be having our ophthalmology presentation, followed by the keynote speech. And from 5 p.m. we'll be having the clinical and preclinical mediquizzes, which will be available on YouTube. And at 7 p.m. we'll be having the Med Confab event. Thank you.
Thank you, Shorodipto. So with that, we can end today's meeting.
And to sum up today's session, like my personal views, yes. Well, it was honestly a very educating session, and like there were two highlights, and one was the unmoderated caucus, and the second one was this draft resolution, because even personally I wasn't very clear about the minutiae of the rules and regulations of this, and personally it was very educating for me also. So thank you, chairpersons.
Thank you, Shorodipto.
Thank you, Shorodipto. Yes, very good.
So I'll ask Sahasra to end this meeting now.
Okay, then I'm ending the meeting for everyone.
Okay.
Thank you.
Thank you all.
Thank you, Chair. Thank you.
Thank you all.